Dhanvantari Namaha. Thank you, Dr. Shruti, for a quite overwhelming introduction regarding the activities which I conducted in the last few years. And I think outside Kerala also many participants are there in this audience. May I know from which state you are belong to? Karnataka? Yes. Maharashtra? UP? Punjab? Gujarat. Okay. Rajasthan. Very good. Madhya Pradesh. Very good. Uttarakhand, Himachal? No. Himachal. Very good. Okay, nice to see all of you. And all of you are currently working as teachers, I assume. Okay. So today I'm going to speak or share some of the experience regarding the conducting Vamana since last few years. Some of the mistakes which I made during my practice, and some of them rectified, some of the innovations what tried to incorporate in the practice of Vamana. Okay. And at the outset, I would like to thank my colleagues for inviting me to such a wonderful platform to share my knowledge. Dr. Parameshwaran Nambudri and all others are my students only here working as colleagues, and few alumni also as audience. So it's a pleasure to me to stand in front of you. Okay. So Vamanam principles and practice. Next slide. I think first slide you go back. Just before that. Yes. So this is all in the Institute of Ayurveda, and one of the Apex Institute situated at Delhi, a postgraduate and research institute. And now the PhD is called for. So last date is 15th. I think 15th or 16th. So I think you can apply for that also, because it's mainly research oriented institute and directly under the Ministry of Ayush. Okay, next slide. So I'm not going too much to the theoretical aspect of the Vamanam or the discussion regarding the theory, but to refresh your memory, to bring you to the track, I just want to highlight some of the points. Like Vamanam is one of the Urdhva Bhaga Haranam Kriya, Urdhva Bhaga Hara Kriya. Why this? This is a basic questions to all the Panchakarma practitioners. Why Panchakarmas are 5 in number? Why they are 5 in number? Why not 7 or why not 8? Why not 6? Why not 3? 3 doshas are there, 3. 3 margas are there, 3. Why not 3? Why it is 5? Yeah, because of 5 elements it is 5. That's not true. Pankaja Shabdavat, like very good. It is given by Chakrapani, because to make a karma as considered to be under the Panchakarma, that should fulfill some certain criteria. That is the thing. So that is why in the Sutrasthana, when the first instance where the word Panchakarma comes in Charakam Samhita, in the Sutrasthana 2nd chapter, Tanyupasthita doshanam sneha swedopapadanai Panchakarmani kurvita matra kalo vichare. Panchakarmani kurvita. So in that context, Acharya Chakrapani discuss why it is considered as karma. What is the lekshan of karma? So there are different definitions for karma as per Padartha Vijnana you might have learned. But in the particular context, Acharya Chakrapani says, Bahuviti kartavyata yogi dosha nirharana shakti jayastum. Bahu kartavyata, iti kartavyata, dosha nirharana shakti. These are the basic 3 parameters which considers a karma as Panchakarma. Bahu kartavyata, iti kartavyata, and dosha nirharana shakti. So Bahu kartavyata means a tool whenever it is applicable in anywhere. It may be in the technology or in any other instances. If it is a multi-purpose tool, then only it has some value. If you want to keep a tool in your pocket, if it is for a single use, only for some particular net, it won't be useful. Instead, if it is an adjustable spanner, then it will be very much useful, and that will be you carry with you if you are a technician. with you always. Similarly, a karma which need to be considered as panchakarma should have bahukartavyata. Bahukartavyata. It should have multi-dimensional action in the body. So, you may be knowing that Sharirjanam doshanam kramena paramaushadam bastir vireko vamanam tadha tailam gratam madhu. Bastir vireko vamanam Sharirjanam doshanam. For the three doshas, three karmas are mentioned. Basti, Vireka, Vamana. So, by Vamana, all of you damn sure that it is for Kapha. For, if you consider Virechana, all of you sure that it is for Pitta. Basti for Vata. So, my question is whether Vamana will do Nirharana of Kapha only? Then what? Yeah, so that is the importance of that karma. Even though Vamana is mentioned for the Kapha Nirharana, at the same time, it will be applicable for other doshas also. That is why in the indications, Acharya Vagbhata says, it's very beautifully, concisely he mentions the indication of Vamana. What is that? What is that shloka? Kaphe vidadyad vamanam samyogeva kapolbani. Kaphe vidadyad vamanam samyogeva kapolbani. So in the kapha vidagdha avastha, samyoga avastha, in all these conditions, Vamana is applicable. So kaphastanagata vata, kaphastanagata pitta, kaphanubandha vata, kaphanubandha pitta, in all these conditions, and kapha prakriti, kapha prakrita purusha, in all these conditions, vayataha kapha pradhana, that is balyavastha, all these conditions are indicated for Vamana. Apart from that, if you see the Samyak Lakshana of Vamana, we can see that Kramat Kapha Pitta Madhani Lascha. In the morning also we discussed, Kramat Nirharana of the dosha happens. Kapha Nirharana happens first, then to ensure that Pitta Nirharana happens, then Vata Darshana also is required. Then only we can say that the Vamana is complete. So that means that all the doshas are involved in the Nirharana process in all procedures. It is true in case of Virechana also. It is true in case of Basti also. Basti, Aneka Karma Karatvad Bastehi, Bastir Nana Vida Dravya Samyogad. Whatever action you want in the body, you can achieve with Basti. That is the beauty of Basti. Only Dravya Samyogad, different Dravya Samyogad. Similarly, Nasya or Shiro Virechana we can see. There are different kinds of Nasya procedures. Ropana, Snehana, Brahmana, Samjna Prabodhana, different varieties of Nasya are there. So that is why these procedures, these 5 procedures are multi-faceted one and it have multi-dimensional action. That is why they can considered as karma. Next comes iti kartavyata, definite action of the procedure. If you do Vamana, you are sure that with the end of Vamana, there will be Kapha Nirharana. That definite action we can achieve with the help of Vamana Karma or the Virechana Karma, Pitta Nirharana. So, iti kartavya. Then, Dosha Nirharana Shakti Jayastam, the forcible expulsion of the dosha. That also happens in these, all the 5 procedures which is incorporated under the Panchakarma. Otherwise, if Dosha Nirharana Shakti Jayastam is not a criterion, then we might have included the Swayadana, we might have included the Lala Nirharana, we might have included the Akshi Srava, because there also the Dosha Nirharana happens, but Shakti Nirharana is not happening. So this is why these 5 procedures are included under the Panchakarma. Okay, and among them, Pradhanyataha Dosha Nirharanatvena Vamana Virechanam as considered as the Shodhana, main Shodhanas, because the Dosha Nirharana is main karma of Vamana and Virechana, unlike Basti and Nasya. Because in Basti, you have Brahmana Basti, you have Ropana Basti, Chakshushya Basti. There are different Bastis. Yapana Bastis are neither Ruksha nor Snigdha also. In Nasya also, there are different Ropana, Snehana, Brahmana are there. But Vamana Virechana, there is only Dosha Nirharana. It is Langhana Pradhana only. But there are certain other concepts also related with Vamana. Brahmana Shodhana, there is some concepts. That is comes in very minute part. Okay. Otherwise, the predominant or absolute shodhanas, we can say Vamana Virechanas are the absolute shodhanas. They do shodhana only. Among them, the Vamana is one of the most easiest procedure which we can perform without any complication, unlike Virechana. Okay. But the practice is different. Because of the fear of complications, the prevalence of practice of Vamana is very less in the society. Because they think that it comes to some unusual way. So that is why it may end up in some complication. That is why the doctors are getting away from the Vamana Karma. But Samyak Pranihita, in the morning also I told, if it is properly planned and executed, no complication at all will be seen during the procedure of Vamana. But in Virechana, of course, there is possibilities of getting complications. In my last 15 years of practice, and even a single case of Vamana didn't require the hospitalization or the IV fluids. But Virechana, it happened. It happens also. Okay, so generally I used to tell one story regarding the hospital, a temple, not hospital, a temple at Alapi, nearby place, Tiruvira Mahadeva temple. It's a Shiva temple. There, the temple priest will perform the Vamana. Temple priest will perform the Vamana. It is mainly for the Garavisha. The one day before, the patient has to go there and do the worship, and the next day morning, the priest will give some kheer, some kind of thing. Then the medicine will be given. Medicine is generally the algae from the temple pond. That will be given, and they consume, and they will do the circumference of the temple, do the production of the temple, and during that he will get the Vamana. And in the temple courtyard, it is near to seashore. So temple courtyard is full of with sand. So they will vomit on the temple courtyard and cover with his feet with the sand. Then again do the production, again vomit. This will be continued till the contents are emptied. And after it is emptied, he will go back and take rest. And the next day he will get the prasadam and he can go. So my question is, if a temple priest who doesn't know the anatomy, physiology, or tridosha, anything, without any fear, without any complications, if performs Vamana, why don't you people, graduates of Ayurveda, learned about anatomy, physiology, kriya, sharira, and the pathology, whatever, what not you studied, why you should fear? So only thing is the initiation. And the other thing is in the Charaka Samhita, Acharya Charaka says, in the Agra Sangraniya, he says, Anabhyase, what is that? Anabhyase Bhayakaranam. Anabhyase Bhayakaranam. Less practice causes the fear. Less practice or not exposed will cause you fear. If you are not seen any basti till now, and if I ask you to give a basti at this moment, you might have seen or learned or heard about basti. It is given through the rectal route, and basti netra will be there, putaka will be there, all those things you know. Even though when you approach the patient, when you hold the basti netra, at the moment of insertion, surely you will start to shake. Tirre kullupta kambita. It's a basti dosha. Because of less practice. So the thing is, unless and until you expose to such practices, unless and until you initiate such practices, never you will get the confidence. So only thing is, understand the basic concepts of the Vamana, understand its various practices, then initiate. That also, Acharya has given very clear guidelines. In the Shodhana also, there are different grades of Shodhana is mentioned. Avara Shuddhi is there, Madhyama Shuddhi is there, Pravara Shuddhi is there. If you are less practiced, go for Avara Shuddhi. If you are experienced, go for Madhyama Shuddhi. If you are well versed, go for Pravara Shuddhi. If Avara Shuddhi is achieved, purpose is served. And there is less chances or no chances of complication. Okay. So it is one of the easy to perform with a great result. I will narrate some of the stories also regarding the iti kartavyata of the Vamana karma. Vamanam and Virechanam are absolute Shodhana karma. Next slide. So I think up to what time I have to take class? 1 o'clock. When? 11 to? 11:15. And 11:15 to 1 again. Okay. Tatra dosha haranam urdhvagam mukhena pitam mukhena dosha nirharanam. Okay. So between Vamana and Virechana, there is a slight borderline only. Because both are same, the procedure. Almost all are same. Even the medicine also same to some extent. Do you agree? Yes, very good. Because up to the Snehapana, Sammyak Siddhakshana, it is same for Vamana and Virechana. Only difference is from Vishramakala, it's different. And Aushadha is also same. How? Exactly. Tatra Sukshma, Ushna, Tikshna, Sukshma, Vivaya, Vikasini, Aushadani. So the basic gunas or the qualities of Vamana and Virechana are same. Only thing is, its Prabhava is different, or its Prithvi or the Panchamahabhuta constituency is different. Prithvi Salilatmakatvat adho gacchati, Agni Vayuatmakatvat urdhvam gacchati. Okay, so the particular Sanghata or the combination of these gunas, Ushna, Tikshna, Sukshma, along with this particular Panchamahabhuta, makes the Prabhava of Urdhvabhagahara or makes the Prabhava Adhobhagahara. So this is one of the demonstrable example for the Prabhava also. Okay, and the problem with the Vamana and Virechana, both are given through the oral route only. Vamana also taken oral route, Virechana is also taken through oral route. So that is why if anybody have experienced Vamana or Virechana, anybody tried yourself Virechana? Yes. After taking Virechana Aushadhi, what you felt first? To go to toilet or to vomit?
Mild nausea.
See, nausea. You have taken the Virechana Aushadhi and you prepared the body for Virechana, but you felt nausea. Why? Because it goes to the Kafasthana. It goes to the Kafasthana and reaches the Urdhva Amasya, which is the Kafasthana. Okay, so that is why for Virechana Acharya says Kapha Kshaya is required, but for Vamana, Kapha Utkleshana is required. Okay. Apakva pitta shleshmano baladurdam nayetu yet. Vamanam taddi vitneyam madanasya phalam yata. This is a wrongly, it is for academic interest I am telling, because all of you are teachers. Apakva pitta shleshmano baladurdam nayetu yet. In the Sharngadhara it is mentioned. And in the commentaries also, there are some wrong interpretations by Gudartha Deepika and by Adhamalla and all. And because they give the Vyakhyana like this, Apakva Pitta Shleshmano Baladurdham Nayetyet. They say that the Apakva Pitta and Apakva Shleshma is expelled from the body. But it is not true. If you go back to the Charaka Samhita, Apakvam Vamanam Dadyat Pachamanam Virechanam. So, the Apakva avastha of the Aushada, Madanasya Phalam Yada. The Aushada which is in the Apakva avastha causes the Dosha Nirharana, and Aushada in the Pachyamana avastha causes the Dosha Nirharana. So that is the actual meaning of this shloka. Next slide. And area of Vamana. So, as already mentioned, Kafei Vidadyad Vamanam, Samyogi Kapolbane, Tadad Virechanam Pitte. Or Virechana we can modify Pitte Vidadyad Virechanam, Samyogeva Pittolbane. Okay, because we can clearly demonstrate the area of Vamana. Kapha Vrdhavastha, Kapha Anubandha Pitta, Kaphasthanagata Anya Doshas, and Kapha Prakriti persons, and Kapha Prakriti Vayataha Kapha Prakriti also, like Bala and Kaphaja Vyadi. Okay, I am not going to detail into the contraindication indication. Next slide. So, this is one of the beautiful benefit which is mentioned in the Sushruta Samhita. Kasopaleba Swarabeda Nidra, Tandrasya Daurgandhya, Vishopasarba, Kafapraseka Grahani Pradosha, Nasanti Jantu, Vamataha Kadachit. Kasa, Upaleba, Swarabeda, Nidra, Tandra, Asya Daurgandhya, Vishopasarga, Kafapraseka, Grahani Pradosha. This is from Sushruta Chikitsa only, Vamana Virechana Vidhi. So, in that, the benefit of Vamana is mentioned. If a person undergoes Vamana karma regularly, this is not for the disease condition, it can be considered for the Swastha Vamana or the Ritushodhana. So, Vasantika Vamana we can say. If a person regularly undergoes Vasantika Vamana, Nasanti Jantor Vamata Kadachit. These diseases never will afflict the particular person. And see the diseases. Kasa, Upalepa, Swarabeda. Some of them are respiratory origin, and Grahani, etc., and Kapha Praseka, and Asya Daurgandhya. Some are GI origin, and Visha is there, Aupasargika is there. Okay. So, GI presentations are there, respiratory presentations are there, Visha presentation are there, Aupasargika is there. And the person COVID-19 also having all these presentations, and it started in the month of February, March itself, and Vasanta Vamana almost comes in the same month. That is the beauty of this Ritushodhana. We can easily demonstrate if a person regularly undergoes these kind of Ritushodhanas, can prevent or may prevent the such kind of affliction with the pandemics or the endemics. Okay, so Chinne Taro Pushpa Phala Pravoha Yadha Vinasham. It's a beautiful simile. Next slide. So, what is the criteria for Vamana? To perform Vamana in a person, what is the basic requisite? For any Shodhana, can you tell? Any Shodhana. Of course, very good. Bahudosha should be there. Then Upasthita doshatva should be there. These are the basic two criteria which is very much required for the performance of Vamana. And in that, Bahudosha Avastha is a must quality, because without Bahudosha we are not going to think about Shodhana itself. If Bahudosha is there, then we can think about the Shodhana. Okay, I will plan Shodhana, but that is not sufficient. We need the Upasthitatva of dosha also. But Upasthitatva again, which can be achievable also, already existing also. Two way it may happens. Achievable in the sense, we can make the doshas Upasthita. Bahudosha Avastha is there already, and we can make it Upasthita also. What is Upasthita dosha? Yeah, because if you want to go out, it is very easy to you for out, because the door is very nearby. If he wants to go out, he has to come in between these people and cross the door. It takes long time, and some obstacles also there. Camera is there, many things are there. Similarly, the dosha nirharana also happens from the easiest route. For that, we have to make it as upasthitatva. And upasthita, Acharya Chakrapani says that upasthita doshanam iti shakantaktva koštagamanena tatha linatva parityagena pradhana avastam praptam. Shakham tektva koštagamanena tatha linatva parityagena. Two conditions are there. One is shaka tektva koštagamana. Shaka to koštagamana of the dosha. And for that, how shaka to koštagamana of dosha happens? Very good. Vridhya vishyandana pakat shrotomukha vishodhanat. Shakan tektva malam yati košto vayoscha nigrahat. So by these actions, the shaka to koštagamana of dosha happens. Next comes the linatva parityagena. What do you mean by linatva parityagena? How many linas you know? We have one Dr. Leena here, not that Leena. Okay. How many Leena avasthas you know? Mainly there are two Leena avastha happens. One is Shroto Leena avastha, and the another is Dhatu Leena avastha. To some point, these may be together single also, because dhatus flow into the Shrotas. Otherwise, Shroto Leena doshas and Dhatu Leena doshas. So then comes how it can be detached. Leena means it is attached to the particular dhatu or attached to the particular Shrotas. So we need to detach these dhatus, doshas from the dhatus or the Shrotas, because this process of attachment happens during the dosha dushya sammurchana. Right? Dosha dushya sammurchana in the disease process, it happens like a Prakriti Sama Samaveta or Vikriti Vishama Samavaya. Different kinds of dosha dushya samurchana may happens. Okay, so here the Lina dosha can be detached also. How it can be? Because of these Snehana and Swedana only. So in the benefit of Swedana, in the Sushruta Samhita, again in the Ashtanga also we can see. In the Sushruta Samhita, Acharya Sushruta says, and Acharya Dallana groups into Shodhananga Swedana and Shamana Swedana. In the Shodhananga Sweda, he mentioned that, what is that shloka? Sneha klina koshtaka dhatuka va sroto luina echa shakasti samstha. So in that, Acharya says that when proper snehana is done, and after that when we do the swedana, then these doshas which is shakasti samstha or srotolina or sneha koshtagata or dhatugatatva, all these can be detached and mobilized towards the koshta. Okay, so that is why these purva karmas becomes very much important for making the doshas upasthita. Upasthita means sitting near to, nearest root. So upasthita dosha. So like that we can make the upasthita dosha. So upasthita dosha can be achievable with the purpose help of the purva karma, and the another is upasthita dosha. It is already existing. Next slide. So again, this is one of the basic Chikitsa Sutra which is mentioned in the Sushruta Samhita, that too in Vamana Virechana Vidhi by Acharya Sushruta. Doshakshena brahmaitavyaha kupita prashamaitavyaha vruddha nirhartavyaha sama paripalya iti siddhanta. This is very famous quotation, but the commentary is better than this. Commentary by Acharya Dallana is much beautiful. Prakashena vruddha Sustana Chalita, Samshodana Vidinaya Nirhartavyaha. Jajjadacharyastu pravruddha iti patanti, vruddhirhi dvivitaha. There are two types of vruddhis there. One is Chaya Lakshana, Prakopa Lakshana. Chayo vruddhi swadam neva. And the another is Prakopa Vruddhi. Samhati Rupaha Vruddhi Chayaha, Vilayana Rupaha Vruddhi Prakopaha. So Vruddhi is again, but we many times without any discrimination we use these terminologies. Dosha Kopa is there, Dosha Vruddhi is there. Synonymously we use, but it is not actually like that. Vruddhi is different, Kopa is different. Kopa is agitated state, Vruddhi is increased state. Okay, so Vruddhi can be Chaya Rupa Vruddhi and the another is the Vilayana Rupa Vruddhi. Tayor Vilayana Rupa Vruddhyaha Vruddha Doshaha Samshodhanena Nirhartavyaha. In that Vilayana Rupa Vruddhi, the doshas which is increased in the form of Vilayana Rupa, that can be expelled with the help of the Shodhana. Okay, next slide. So, how to make we can upasthita? I already mentioned one is naturally which is situated, and the another is with the help of the pura karma. Naturally happens when it happens. In some of the disease conditions we can see the doshas in the upasthita avastha. In some particular age group, Vayoratri Bhuktanam Te Inta Madhyatika Kramat. Accordingly also the doshas will be in the upasthita avastha. So like that Vyadhi avastha is Navajvara is such a condition where doshas already in the upasthita. A morning somebody was asking, what is the concept of Sadyovamana actually? So this is the concept of Sadyovamana. Doshas are in Bahudosha avastha. Doshas are in the upasthita already. Need not to do any other thing, just to put it out. That is the Sadyovamana. Okay. So upasthita dosha is already achieved. So that is why Acharya Chakrapani says we need not to go for any sort of purva karmas in that, because swayameva cha utklishyat, we can directly induce the vamana. But if the particular condition is not achieved, and if you are performing vamana, you are going to harm the patient. Okay, there are certain practices in Maharashtra also, because last month I had been to some of the areas. The Sadyovamana is indiscriminately practiced. But in a class I took there regarding Vyapat, Vamana Vyapat. Yeah. So I commented on this also because Sadyavamana, they consider it as person comes directly and induce Vamana, okay, go back. They consider it as the Sadyavamana, but it is not true. Sadyavamana is very much condition specific. If fulfills Bahudoshavastha and Upasthita Doshavastha together, then only we should perform the Vamana. Okay. Then comes whether Swastha is indicated for Shodhana. Swastha is indicated for Shodhana or not? Who agrees? Still some people are not agreeing. Who agrees? Swastha is indicated for Shodhana or not? Yes, okay. Who disagrees? Who disagrees? Why? Tell.
स्वस्थ का डेफिनेशन समदोष समानता स्वस्थ का डेफिनेशन समदोष समानता वहाँ से समदोष है तो फिर उसको दोष नहीं करते उसके अकॉर्डिंग
You want to counter with him?
But in case of Ritu,
वो स्वस्थ नहीं है फिर
नहीं but biological clock और Ritu के
उसमें भी सभी शोधन के योग्य नहीं होते उसमें बताया
योगी होते तो अलग है वो डिसीज ओरिएंटेड है
उसको भी जरूरत नहीं
जो भी योगी होगी वो डिसीज जो भी योगी आयुर्वेद वो तो डिसीज ओरिएंटेड बताएंगे ना आपको स्वस्थ का कोई रेफरेंस नहीं है
नहीं वो बताया वहाँ भी बताया है लेकिन जो स्वस्थ के अनुसार से शोधन करते हैं उसमें सभी का नहीं करना उसमें सिर्फ जहाँ जरूरत है वही करना जैसे भाई जो डेली व्यायाम करता है उसका नहीं करना
बट जो बसंत ऋतु में
हाँ तो बसंत ऋतु में बता रहा हूँ ना उसमें भी सभी का नहीं कर सकते जो डेली व्यायाम करता है कृष्ण है उसका नहीं करना तो स्वस्थ
वो तो कंडीशन हो गया है क्वेश्चन है कि
वही तो बोला ना स्वस्थ है तो संतोष है तो नहीं करना
Anybody want to join? Yes, you can join.
वहाँ पर स्वस्थ बताया तो सभी का नहीं करना है
Otherwise, they will be roaming around the same bush. Join. Okay, sit. Very good, very good. Both are correct, both are wrong also. Okay. Swastha is contraindicated for Shodhana. That is a basic rule. Swastha is contraindicated for Shodhana, as he told. Samadosha, Samagnischa. Samadosha is there. Why you want to trouble that Samadosha avastha? Why you want to trouble that Samadosha avastha? So don't trouble Samadosha. Sama paripalya iti siddhantaha. Sama paripalya iti siddhanta. How paripalana is done? How paripalana is done? Because kramadapamapi mano panko avasyam bhavetyatha. Uttishteda yadha kalam. Malanam Shodhanam Prati. In the Sutrasthana Ashtanga Sangraha says, Kramad apamapi mano panko avasyam bhavetyatah uttishteta yatha kalam malanam Shodhanam Prati. So even a clean, beautiful stone kept in clear water for a longer period, it will get some deposits of the mud over that. Even though person is swastha, during the course of the Kala Vyatireka, Ritu Vityasas, Ahara Viharas, in that also there is some changes in the dosha may happens. So that is why Acharya Charaka says, Chaya Prakopa Prashama. Chaya Prakopa Prashama. So 3 Ritu Kriya Kala he mentioned. Chaya Prakopa, then comes the Prashama. If the person strictly follows the Ritu Charyas, Dina Charyas, Ratri Charyas. As a part of Ritucharya also again the Shodhana comes. That is why if you want to perform the Shodhana in Swastha, only Ritu Shodhana is indicated. Very much condition specific. Swastha, Vamana can be done in Vasanta Ritu. Virechana can be done in Sharad Ritu. Otherwise, there is a simile is given. If a Krishna Sarpa is sleeping, just waking it up, drink milk. It will bite you instead of drinking milk. Similarly, the doshas are in its equilibrium, its balance. Don't trouble it unless and until required. So, Ritu Shodhana is indicated for the Shodhana, Aswastha. That is why she is right, In that aspect, he is wrong. Otherwise, he is correct. Swastha is contraindicated. She is wrong. Okay? So, very much condition specific. That is why it cannot be generalized like this also. Sadhyavamana also. So, this is the problem of the practitioner of Panchakarma. Many things we generalize. We taken it for granted in all the conditions. But they are very much condition specific. So, already Upasthita Avastha, of course, we can go for the Vamana. Because in the Navajora, Kapha Pradhanan Utklishtan, Doshan Amashe Sthitan, we can perform the Vamana. In Bala, Prayena Kshira Grita Shitvat, the general diet of Bala is Kshira and Grita since birth itself. So that also causes the Kapha Utklesha already. And because of the Vayoratri Bhuktanam, Vayataha, Balyavastha is Kapha Pradhana, so we can do the Vamana in Bala. That is why first Panchakarma procedure performed in a human being is Vamana. What is that? Context? Jatamatram Vishodhyat Bala Dulbam Saindava Sarpisha. Saindava Sarpi, using the Saindava Sarpi, Vamana is performed. That is the first procedure, Panchakarma procedure introduced in a human body. Right? Next slide. So, execution of Vamana. We will come to the actual execution of Vamana. And here, Acharya very clearly given the instructions, because Panchakarma is such a Shastra which can be directly translated from the text to the practice. Whatever written in the text, you are going to apply in the patient. There is no change. So my motto while teaching Panchakarma is text to practice. Observe that, obey the text and practice accordingly. Never you will fail, never any kind of complications. Whenever we try to dilute the principles, of course there will be chances of less result or chances of more complication also. So Vamanam mainly classified into Purvakarma, Pradhanakarma and Paschatkarma. And this is not the actual classification for the Shodhana procedures, but as adopted from Dallanacharya in the context of the Shastra Vidhi, because it is mainly mentioned for Purvakarma for the Shastra Vidhi only. But Dallanacharya says Snehadi also can be classified in this manner. So it is for better understanding we will adopt. Purvakarma, Pradhanakarma and Paschatkarma. So in the Purvakarma, Pachana, Snehana, Swedana and Utkleshana, and Pradhanakarma, Dosha Nirharana, and Paschatkarma, Samsarjana. After that, it can be Rasayana therapy, it can be Shamana Chikitsa, or it can be Vajikara Chikitsa. Because Shodhana is a Purvakarma for the Rasayana and Vajikarana. And Shamana is a Paschatkarma for the Shodhana. And Samsarjana, of course, we need to adopt for the Agni Vardhi. Next slide. We will see one by one. So, Purvakarma, as already discussed, Vridhya Vishyandana Paka Sroto Mukha Vishodhanat. Shakhan Tektva Mala Koshtam Yanti Vayoscha Tingrahat. So, you know, Vridhi Vishyandana Paka, all these are required for the Doshotkleshana or to detach from the Shrotas to the Koshta. Mobilize the doshas. What is the role of Vayosha Nigraha?
Vayu and Loman. Because all the other dosas are controlled by Vata, so first we have to get the Loman of Vayu.
Very good, very good. Anloman, what you mean?
Means Vayu should act in its Prakriti way.
Very good, very good. That is the correct answer. Anulomana doesn't mean that it should be always downwards. It's not like that. Anulomana means right direction of the Vata. Because when the doshas are in Sneha Bhavikite Kaye, Snehakta Bhajanastamiva, Tailam, Kshaudram Asajjan, Anupravana Bhavat. So it will be spreading all over the body because it is already detached from the srotas or the dhatus, and it is in a mobile phase. At that time, Vata, if it is not controlled, the moving doshas will be taken to some other place and do the samprapti of other place, some other disease. So that is why the Vata should be in a controlled manner. If I want to blow some paper pieces to her face from here, if I put a fan here and blow it, how it will, whether it will hit her face directly? No. few pieces to hair face, to few pieces here. But if I put a pipe in front of that and concentrate the air through that pipe, surely the papers will hit on the hair face, right? Because it is controlled. Similarly, Vayoscha Nigraha, the controlling of the Vata is very essential. So that is why the Purva Karma comes in such a beautiful package. Snehana is there, Swedana is there, Pachana is there, many things are there. Okay, so I'm not going to detail into Snehana Swedana because already some other classes will be there. But Pachanam I want to discuss a little more because what do you mean by Pachana? And how you are going to achieve, what is the role of Pachana in this Purva Karma? Can anybody share? So there is a hint. Pachanam hi rukshanam. Acharya Dallana. Pachanam hi rukshanam. We can achieve Pachana in both ways. External also, through internal also. With the medications internally and externally through some of the procedures like Dhanyamladhara, Uddvartana, etc. etc. Okay. So Pachanam itself is considered as rukshana. What is the role of rukshana prior to snehapana?
To remove the
Srotorodha. Very good. Then?
If any patient taking sneha regularly,
Yeah. In that case, we have to go for rukshana to reduce the snigdhata in the body. Very good. Then? Amapachan. What do you mean by Amapachan? Ama gets digested. Avipakvam asamyuktam durgandam bahupichilam. Ama is avipakva, asamyukta. Then how are you going to get digest the ama? Yeah. So how amapachana happens with Agni-vruddhi? Again, there is another question. Whether ama is we can remove from the body, ama nirharana is possible? Because these are some of the basic cliche-like misbeliefs in your mind.
Arm should be digested only, not. It is digested.
It is digested. Anybody else? Ama, whether ama can be removed from the body or not? ama जीर्ण में वमन कराते हैं. कोष्ठ से निकालते हैं. ठीक है. Any others? हैं? After? Langan? The basic concept of Shodhana comes from Ama Chikitsa only. Right?
ऐसा बताने की
हाँ.
पोस्ट में आम है तो उसको डायरेक्ट निकलना है,
हाँ.
लेकिन सर्वदेह संपृक्तान सामान्य नहीं है.
Very good, very good, beautiful. So that is the answer. Ama is, we can remove the ama from the body. Ama never can be digested. It is a misconcept. Because ama is avipakva only. Ama pachana means, what does it mean? Ama will be getting attached to some of these rotas or dhatus. So ama pachana means we can make the ama pakwa and detach from that srotas or the dhatus. That is possible. That means the pachana. And it can be achieved with the rukshana also. For example, if some sticker is there, yeah, I am going to peel out this sticker with the hand. What will happen? Some part of the sticker will come out, some part will remain there itself. Or if at all, if it comes out beautifully, its gum will be remaining there. And after the end of the CME, next 2-3 days, there will be some black patch over this area, like this. Because of the gum is there, further accumulation of dosha happens, the dust happens, and it will become blackish. How you can remove that? Take a knife and scrape it. It will be removed. What happens by that? The dust is removed, dosha is removed, but there may be holes in the plastic bottle. So how beautifully we can remove this? Apply some oil over that, do the snehana, and wipe it with warm water. Easily, beautifully, we can remove without causing any injury to the bottle. Same principle is adopted in the body also. The ama, which is situated in the dosha, will be detached with the snehana, swedana or so-called pachana, rukshana, and it can be removed. So that is the basic Chikitsa Sutra for Shodhana is Tatralpe Langhanam, Madhyame Langhana Pachanam, Prabhute Doshavasechanam. There is Ama Chikitsa, not the Shodhana directly explained. So in the Ama Chikitsa, Prabhuta Avastha, Doshavasechana is mentioned. So Ama we can remove when it is in the detachable form and in the Koshta. If Sarvadeha Pravisritan, Saman Doshan na nirharet. That is the contraindication for the not doing Shodhana for Ama. If the Ama is spread all over the body, we should not perform Shodhana because it is spread all over the body. And the simile is also beautifully given. What is that? Falad amad rasaniva. If you try to squeeze out the juice from a apakwa amrafala, if it is not ripened, if you try to squeeze out the juice, you will get the juice like this. You can remove it with a knife, but it will spoil the bottle. Similarly, the amrafala also gets spoiled. Its nut will be crushed. It will not be no further use. But if it is a ripened fruit, ripened with the oil and the warm application, heat application, the gum will be easily get vishyandana. Vishyandana means vilayana, liquefied, easily removable form. Similarly, if it is pakwa avastha of amrafala, mango, you can just squeeze it, put a hole, you can easily get the juice without causing any wrinkle to the skin also, any trouble to the seed also. Same principle we should adopt in the Shodhana also. Then what Pachana actually do? Pachanam hi rukshanam. So the human being or a Purusha, the basic quality of Purusha is Snehasaro ayam Purushaha. Snehasaro ayam Purushaha. What is Snehasara ayam Purusha means?
हमारी धातु में भी सब बहुत ज़्यादा स्नेह के सिमिलर हैं, हमारा सारी स्नेह.
So body is full of sneha. So sneha saro is a basic inherent quality of a Purusha. Sneha saro ayam Purushaha. So basic default quality we can say is sneha. So in this snigdha sharira, again I am going to try induce snehana. So that is why Acharya mentions we should achieve samyak snigdhata, not simple snigdhata, because she is already snigdhata. Even I do rukshana also, she will be snigdha only. But the amount of sneha will be reduced so that we can make it further add on the sneha. For example, if a sponge is there full of water, I want to add half glass of water to the sponge. What you do? You pour the water to the sponge, some amount will be absorbed, remaining will go out. Instead, you just squeeze it and put the half glass of water, it will be absorbed properly. So this is the method we are going to adopt. That is one concept. Sneha saro ayam Purushaha. What is the action of sneha? What sneha is going to do in the body? The basic quality of sneha. Sigdha. Sigdha guna. What is the definition of Sigdha guna? Aruna Datta. Sutrasthana. That is the action of sneha. Guna of Sigdha. Sigdha guna. Defined as Yasya dravyasya Kledane shakti sa Sigdha. That which causes the kledana in the body. So sneha means kleda in the body. Kleda means? Kleda means? Kleda. Kleda means water. Simple form. Kleda is water in the body. And the modern physiology also says major portion of the human body is filled with water. Sneha saro ayam Purushaha. Okay. So that is the same thing. So Sigdhata is inherent quality which is achieved with the kleda, and further we are going to add on the sneha to that particular kleda, add on the kleda to that particular basic kleda with the help of snehana externally. Okay, again, For that we need to do the rukshana. Rukshana causes the kleda shoshana. Rukshana causes the kleda shoshana. A wet log piece put in the sunlight for half an hour, some amount of water will be dried out. It will be kept all day. It will, by the end of the day, it will become more dry. So kleda shoshana happens with the help of the agni, heat. So rukshana in another way causes the agni vriddhi, which is responsible for the kleda shoshana, which is responsible for the agni vriddhi, which is very much required for the consumption of the sneha, which is given in the arohana matra for the purpose of shodhananga. How? For that you should go back to your physiology class. So, digestion mechanism, how it happens. Pachaka pitta, how it acts. Pachaka pitta, can anybody recollect? Panchabhutatmakatve api yat tejasam gunodayat tektadravastvam pakadikarmana anala shabditam. Tektadravastvam pakadikarmana anala shabditam. So all the pittas are panchabhutatmaka only, and pachaka pitta is little different, and in that Acharya says tektadravastvam panchabhutatmakatve api tejasa yat tejasa guno bhuishtat. Because of the increase of the tejo guna. Agni guna is more in the pachaka pitta. Tektadravastvam. And in that tektadravastvam, drava is removed from the pitta. Pitta is having basic quality of pittam sasneha tikshnoshnam lagavisam saram dravam. Dravam is the basic quality of pitta. In that drava portion is removed so that it becomes more pakadi karma. It will be more tikshna in nature, causes the digestion mechanism. So, how we will remove the drava from the body? With the help of the rukshana, with the help of the pachana. That is why agni is getting increased by reducing the kleda. You can relate with the life examples also, because our entire strength of our siddhantas are based on the loka purusha samyavada. Compare with the external world. That's why I am giving these kind of examples so that you can easily relate. Okay, so there are certain materials which causes paka, dravas guna is drava rupa is there. Okay, because in the context of this particular shloka, Acharya Arunadatta gives a wrong commentary in the context of tekta dravatvam. Acharya Arunadatta says tekta dravatvam iti sanjata kathinyam. He says sanjata kathinyam. It becomes kathina. Kathina like a stone. If it is in a stone form, it won't do the pachana. It is stone, it is inert. It will stay there and it won't do any digestion mechanism. But sanjata kathinya is also a state of pitta. Where we can see sanjata kathina pitta? Yes, gallstone, gorochana. It is also pitta, but it doesn't have the basic qualities of pitta. Instead, it reduces the pitta, gorochana. If it is given internally, it reduces the pitta because it doesn't have the basic qualities. But it is pitta itself. But it is kathina pitta. Instead, in the same context, the Indu, Acharya Indu gives a beautiful commentary for the tekta dravatam. He says that tekta drava swabhavam. So we should know what is the drava swabhava. What is drava swabhava? Drava. Definition of drava. Yasya dravyasya vilodane shaktihi sadravaha. Vilodana, which will do the wetting capacity. वो wet करेगा. Vilodane shaktihi. Drava, which causes the vilodana. So that quality is not there. But still it is drava rupa only, in liquid form only. But it won't wet. Can anybody name such a materials which in liquid form but won't wet, but instead it will do the paka? Burns. Liquid form, won't wet, but do the paka. That is pitta. Acids. Acids are in liquid form. If you pour to the skin, it will burn your skin instead of wetting. Again, to the acid. 1 glass of acid is there. I add 1 glass of water to that. Now what you call it as? Diluted acid. So the Paka Karma compared to the previous acid, how it will be? It will be some irritation, skin irritation will be there instead of doing Paka, because it is diluted with Kleda. So Agni also like that. When Kleda is more in the body, the Agni also will become Manda. Mandagni happens. So we need to remove the Kleda, doing the Pachana, in terms of Rukshana, doing the Kleda Shoshana, causing the Agni Vriddhi, making it more concentrated. So that is why in the context of Jora Chikilsa also, Acharya Chakrapani says, there are 2 types of Pitta is there, Sadrava Pitta and Nirdrava Pitta. When the Pitta, Nirdravata is more, it becomes more Paka in nature. Like in the Jirna Jora concept, Ruksham Tejo Jorakaram, Tejasa Rukshitasya cha. It's a cycle. Ruksham Tejo Jorakaram. By doing the Langhanadi Kramas, Kashaya Panadi, Langhanadi Kramas continuously, the Rukshata in the body increases. Because of this Rukshata, the above said mechanism, I explained till now, with this mechanism, the Rukshata increases in the body, which causes the Tejo Guna in the Pitta. Because of Tejo Guna, Pitta increases further. Because of Pitta, Jwara increases further. Because of increased Jwara, further Rukshata causes. And this is a cycle. That is, so these things you can relate. Rukshana, Pitta, Drava Shoshana, Kleda. Because these are the basic, some of the basic terminology which comes always in your way when you practice the Shodhana. So Rukshana causes the Agnivriddhi, which is required for the Snehapana. At the same time, Rukshana will cause the detachment of the doshas also. Okay, next slide. So, Pradhana Karma, again we can divide the Pradhana Karma into various aspects. One is Kala and Manasopachara, the Yavagupana, then Akantapana, Aushadapana, and Muhurta Manupana, and Paricharaka Vritti, and the other conditions, the supports which we require to give for the Vamana Karma. All those comes under the Pradhana Karma. Among the Kala, again the Kala can be divided into 2. One is Vyadhyavastha and the Kshanadi Kala. Roga Kala we need to see before Vamana, the Vyadi Kala, or according to the time, morning, evening, like that we have to see. For performing the Sadhya Vamana, the Kala is not much importance when compared to the other classical Shodhana, classical Vamana. Because Sadhya Vamana is done in the Vega Kala itself. That is Vyadhi Avastha only. In the Vega Kala, when the patient is having Amla Pitta Vega, at that time we can do the Sadhya Vamana. Because Urdhva Amla Pitta is indicated for the Sadhya Vamana. And Jwara, when the patient is Jwara Vega, at that time we can perform the Vamana in the Jwara. And in the Tamaka Shwasa, when the patient is having Shwasa Vega, at that time we can perform the Sadhya Vamana. So that is why it is more related with the Vyadhi Kala or Kshana Vyadhi Avastha, we can say. And the another conditions, all the classical Vamana, it should be performed in the Kapha Kala only. Kapha Kala generally comes in the Purvana, mainly in the morning hours. Okay. So morning hours, in the Kapha Kala, we have to perform the Vamana Karma. So that is why early morning, generally we start the Abhyangam and all. And before the Kshuddha Pradurbhava starts, the Prakopa of Pitta happens. Before that, we need to start the Vamana Karma. Okay. Manasopachara. This is one of the very essential thing for the performance of Vamana Karma, because I already discussed in the morning also. Because to get a proper Vamana execution, we need lot of cooperation from the patient. We can achieve the cooperation only by properly educating him. Once he undergo the Vamana Karma and realize the effect of the Vamana Karma, next time he will come himself without any hesitation. But for the first time, it will be always difficult. Once during my postgraduate studies, when I was in Hassan, so once I was performing Vamana to a patient, old man, a Kitiba Kushta case was there, a farmer from Hassan. So in between, suddenly he stood up from the table and came to beat me. Okay, because he told, I am not ready to drink, whatever you want to do. Okay, this also happens sometimes because he himself came for the admission and for the treatment, but still, at that particular point, the patient may behave like anything. Okay, so we should be equipped to manage all those conditions. Okay, and nowadays it is very essential to get the consent also. Okay, because anything happens wrong during the Vamana Karma, we should be in a safer side. So take the required consents and all. And Manasopachara in the sense that we should educate why the Snehapana is given for him, what is the benefit of Snehapana, what we are going to do in the next day during the Vamana Karma, and after the Vamana Karma, during the Vamana Karma, what he is supposed to do, what we are going to do, how he should cooperate for the proper outcome of Vamana Karma. All those things we can educate the patient. And you can show the videos also of Vamana if you want. This is how the Vamana is happening. Because the problem with these things is, so when we post a patient for Vamana Karma and without giving any proper informations, and we left. Next day Vamana is posted. So throughout the night the patient will be thinking about, anxious about the procedure. What they are going to do. He told 5 liter water will be drunk. What is going to do? So what will happen? How I can do that? How it will be vomited? This kind of anxiousness will be there. Chinta. Chinta prasakta causes the rukshata. Because of that, sleep will be disturbed. Again causes rukshata, vata vriddhi. So next days, we are supposed to achieve the kapha utklesha. Instead, kapha kshaya will be there. And proper vegas will not be happening. So that is why we should ask the patient to sleep in proper time without thinking, remove the anxiety and all. For that, Manasopachara is very essential. Snigdha Yavagu, I already discussed in the morning what is the importance of Snigdha Yavagu. Then Akantapana. Whether Akantapana is required, is must or essential for each and every Vamana. It's not an integral part of Vamana. It's not a must for each and every Vamana. Akantapana is optional always. And also, Vyadi Anurupa Akantapana can be selected also. Like Yusha, Rasa, Takra also can be to some extent, Kshira, and Ikshurasa, Madhya. All those things can be used for the Akantapana. According to the patient's condition, we can select this Akantapana. Because sometimes the patient says that I am totally having aversion towards the milk. And if you forcefully ask him to drink Akantapana, Akantapana will not happen at all. By taking one glass itself, he start to vomit. So further, it will be difficult for us to give the aushadhi. So in such conditions, we can go for the other sort of Akantapanas, like Yusha can be given or Ikshurasa can be given. Okay. So Akantapana ease out the procedure of Vamana, reduces the Vata Prakopa, and it helps for the easy evacuation of the doshas. So that is why if the patient is Balavan and the doshas are in much Utkleshita Avastha, we need not to go for Akantapana also. Directly we can go for the Vamana Aushadhi. Actually, one of my student who has done his PG from Kottakkal Ayurveda College, so he has done the same thesis, Akantapana, Vamana with Akantapana and without Akantapana. Okay. So in both condition we can see the dosha nirharana, but number of vegas will be less in Akantapana. And actually my father was also used to do the this Vamana with Akantapana with 1 glass of milk, then Aushadha, then Vamana will be performed, and Vamanopagas are not usually given after that. Directly after that the Vamana Vega will be coming out. So there are different practices. So according to your skill, we can formulate the thing. So the morning what we demonstrated, it is a simplest and safest way of performing Vamana without causing any much of complications. Aushadha. Aushadha is the most important part of any kind of Shodhana. So a Shodhana can become Tikshna, Mrudu or Madhyama. Tikshna, Mridu or Madhyama. How? Because in some of the Chikitsa Sutras it is mentioned that we should go for the Tikshna, Rechana, Mridu, Vamana, etc. How it can be achieved? Drug, dose, then combination of Aushadas, Anupana, then Bhavana, then form of preparation, Koshta, Kal,
Physical and mental strength of the patient.
Who decides the Murdu, Madhya and Tikshnata of the Vamana? Whether the patient decides or the Aushada decides or the Vaidya decides. We decide whether the Vamana should be Murdu, Madhyama or Tikshna. Right? So, we should wisely plan whether what sort of shodhana we should achieve in the particular patient. In the Charaka Samhita, Kalpasthana it is mentioned how a Tikshna, so same qualities should be there. The Aushada should be Nava, then it becomes Tikshna. The Aushada is Purana, it becomes Mridu or Madhyama. If the Aushada is Ajandu Jagda or Dagda, fresh in nature, it becomes Tikshna. If it is rotten or some part, then we are using, then it becomes Murdu or Madhyama. If we give the dose, in the text it is mentioned 10 gram and we are giving 12 gram, then it becomes Tikshna. If it is given in the same dose, it may becomes Madhyama. If it is less dose, it become Murdu. Okay, then of course Bhavana. Various kinds of Bhavana also causes the Murdu, Madhyama and Tikshna. Apart from that, this is related with Aushada. Apart from that, Purva Karmas. Purva Karmas also plays vital role in decision of the Tikshnata, Madhyamata or Murduta of the Shodhana. If proper Sneha Karma, Snigdhata is achieved, maximum Snigdhata is achieved, and we are performing the Vamana with a medium dose, that may become Tikshna also. If Snigdhata is not achieved properly, and if you are giving Tikshna Aushadhi also, that may act as Madhyama. So, the Samskarana of the Sharira is also very important to decide the Shuddhi or the nature of the Shodhana achieved, whether it is Madhyama, Tikshna or Murdu. Okay, so all this, the controlling factor is, of course, Vaidya only. Vaidya decides whether the patient needs Tikshna Shodhana or Murdu Shodhana or Madhyama Shodhana. Accordingly, he plans the Snehapana, Swedana, etc. Accordingly, he selects the Aushada. Right? And of course, there are some unexpected factors may arise in between also. That comes under the Vyapat. Otherwise, it will be smoothly going and that decide according to the planned manner it will end up. Right? So that is why the Aushada is very essential. The nature of the Aushada is very important. We will discuss Aushada in a separate slide. And Muhurta Palana. So what is the importance of Muhurta Palana? Already we discussed in the morning. Muhurta Palana in the sense we have to wait up to the Muhurta maximum duration. It doesn't mean that we should not perform Vamana after 15 minutes or 20 minutes. It's not like that. Muhurta Palana is maximum duration. We should wait. If it is not coming out with that also, we can make some initiation. And if crosses Muhurta, it slowly start to get digested and may end up in the Virechana Vega. So that is why always better to have. For example, patient has given the Akantapana, Aushada is given, and after the Akantapana, 5 glass milk he has taken, 1 glass milk he already put out. And you given the medicine, and again half glass of milk he vomited. There is no meaning of waiting up to Muhurta. to get the Vamana Vega. It won't come. Because the Akantapana, what you have given already, that nausea is came out with the vomitus as a vomiting Vega. And after taking medicine, some part of milk again came out. Medicine is still there. But still, you can't expect a proper initiation of the Vega. Even we wait up to the Muhurta. He may be having some discomfort. So in such conditions, we can directly start to induce after 15-20 minutes of intake of the Vamana Ushadhi. We can start initiating with the help of one more glass of milk, or some smell introduction, or again giving the Vamanopaga Dravyas. Paricharaka Vritti. Paricharaka Vritti is very essential. So, a proper Paricharaka should be there during the Vamana Karma. And then the quality of Paricharaka mentioned in the Charaka Samhita, during the context of Vamana, there is one more quality is added. Anapatra Paniya. Anapatra Paniya is a quality that the Paricharaka should have. What is that? Alajjavan. Alajjavan bataya hai na? So, he should not hesitate to do any sort of things which supports the patients. Sometimes क्या होता है, वोमिटिंग के टाइम पे पेशेंट उसके पैर पे वोमिट करेगा परिचारक का, नहीं तो हाथ में वोमिट किया. ये पेशेंट को छोड़ के हाथ धोने के लिए गया तो ठीक नहीं होगा ना. पेशेंट को सपोर्ट करना है. If he becomes stable, he can go and wash. That quality should be there for the Paricharaka during the Vamana Karma. And Vaidya also should be like that. Okay, so we should be cautious. You should not fall on our body. So stand on the sides. Then Upavegan Apravritan Pravartiyet. So during the Vamana Karma, we should give clear instruction to the patient how we should encourage the vomiting. So after intake of the Vamana Ushadhi, the patient ask the patient to concentrate on the Vamana, think about the happenings in the stomach. क्या होता है stomach में, any discomfort, how it is moving, whether you are feeling nausea. Think about the Vamana and think about the medicine is coming up like that. Because ekagra manasa pitam, sumanasa, like that many words is used always with the effect of Shodhana. In all the Shodhana you will come, you can see that. The involvement of the patient on the procedure is very essential. Because after intake of the medicine, if we are chatting continuously with somebody, laughing, his mind will be diverted from this nausea. So we do that, no? Sometimes when we travel in the bus, if you feel nausea, we will divert our mind from this, looking to the other things or exposing to the wind or thinking about something else. Same way, the Vamana Vega may get blocked with the intelligence in other activities. So that we should avoid. We should ask the patient to think about the Vamana, concentrate on the procedure to enhance the proper output of the procedure. So here one more terminology comes, Upavegan. So morning we discussed Vega. Here one more terminology comes, Upavegan. What is Upavega and Vega? What is that?
थोड़ा छोटा होगा उससे, कम ड्यूरेशन के लिए आएगा, उसमें स्टार्ट होकर के इसमें मुंह से स्टार्ट होकर और तब तक हो जाएगा, इसमें वहाँ तक नहीं पहुँचेगा.
ठीक है. So it can be considered as Upavega. So Vega means Pratigrahagatan Avekshitam Tab. So started from the mouth, touching the tub. That continuity is there. That is Vega. Near to Vega, Upavega. So as he rightly mentioned, start from the mouth and fell on the tub. There is no continuity. That can be Upavega. Or again, the patient has severe nausea. Like that he will be doing, but it is not coming out. That is also Upavega. Need not to come out. That feeling इधर तक आया है, बाहर नहीं आ रहा है. उसको क्या करना है? अप्रवृत्तान प्रवर्तयेत. ऐसा है तो we should initiate. उसको प्रवृत्ति करना है. कैसा? How we have to do the प्रवृत्ति? Angulibhyam anayasto nalena murdhunadhava. So by putting the anguli and the nala, etc., and initiate the Vega. Okay. So if it is properly pravartamsha pravartayet. Oh, just leave it for the course. Or if it is naturally coming out. Otherwise, If it is upavega and it is not coming properly out, we have to induce that with the help of the anguli or nala, whatever it may be, some smooth rubber catheter also we can use to touch the throat. Generally, I instruct the patient to put 2 fingers and instead of touching the throat, just touch the back of the tongue, just press downwards gently, so that will induce the vomiting. Okay, so sometimes the patients with over-obedient patients, they will they will do something. If you ask them to insert the finger, they will put the finger in the mouth, like that they will do. You might have observed. And it will cause some injury to the throat. And next vega we can see Rakta Chandrika. Okay, so that should avoid. We should clearly instruct. That is why I told, always the instruction should be very clear, crisp and one point. नहीं तो क्या होता है, सभी वमन विशारद बन जाता है उसी टाइम पे. फ्रॉम हियर वो जो मिल्क दे रहा है वो भी इंस्ट्रक्शन देगा, पीछे परिचारक खड़ा है वो भी इंस्ट्रक्शन देगा, आगे वैद्य खड़ा है वो भी इंस्ट्रक्शन देगा. सो लॉट ऑफ इंफॉर्मेशंस. he will be confused. कुछ भी नहीं सुनेगा, वो खुद का मर्जी पे follow that. Okay, so ऐसा नहीं है. It should be clear instruction should be given and one point. A person should take the lead and he should only give the instructions continuously. Okay, next slide. And some of the various stages. So Akhandapana, then clearly you can see the projectile vomiting with the milk. And in the third picture with the Yashti Fanta, the continuity you can see from the mouth to the tub. And this is Anguli Pidana on the throat. And again with the Saindava Jala and Dhumapana. Okay, leave it. Next slide. Coming to the Shuddhi Prakara. So conduction is easy. Assessment is difficult. How we should understand the Shuddhi, whether the proper Shuddhi happened or not. There are 4 types of Shuddhi Prakaras are mentioned in the Samhita. Chatush Prakara Shuddhi. Sorry. Jaganya Madhya Pravaretu Vega. Jaganya Madhya Pravara. So Chatush Prakara Shuddhi is there in the Laingiki Shuddhi, Antiki Shuddhi, Maniki Shuddhi and Vegiki Shuddhi. Further classified into Pravara, Madhyama and Avara. Okay. So Laingiki Shuddhi, I consider it as major portion of the Vamana assessment. Then comes the Antiki Shuddhi and then comes the Maniki and Vegiki. Because Vegiki and Maniki mainly depends on the numbers. Okay. In Panchakarma or in Ayurveda, the numbers are not much important. Always count on the lakshanas, what we observe on the patient, what we see on the patient's lakshanas, etc. So always count on the Laingiki. In the context, Chakrapani also very in detail discuss regarding the Laingiki Shuddhi and Antik Shuddhi, etc. Okay. And Antik Shuddhi is when it becomes important because it is one of the objective tool to understand the end of the procedure. Okay, Antiki Shuddhi, we can see the Pitta, we can see the Kafacheda, we can see the Pittantata, then we can stop the procedure. So this is the indication to stop the procedure, Antiki Shuddhi. Okay, now we can stop. Similarly, for other Shodhanas also, some indicators are there. For Nasya, for example, what is that? By seeing this, we can stop the procedure. What is that? Aushadha Darshana. Samyak Lakshana is mentioned already, but to stop the procedure, Samyak Lakshana can be achieved during the course of the procedure, maybe on the next day or the next day all. But to stop the procedure on that particular point, it is mentioned Aushadha Darshana. The medicine which is put on the nose, we can see on the sputum cup. Then we can say, now it's okay, stop the procedure. Otherwise, we should again give the Swedana and Uchshrinkana, Nishtivana should be continued till Aushadha is coming out. Otherwise, again put the second dose of medicine. Okay. Similarly, Antiki Shuddhi is such a marker which shows that now the procedure is fine, we can stop here. Okay. So, among this, Vegiki and Maniki, because Vega we can achieve maybe 7 or 8 or 9 or 10 also. Unless and until we didn't achieve the Laingiki Shuddhi, the Vega doesn't mean anything. The quantity, sometimes what happens, 8 liters of total quantity is given inside and came out only 7 liter 800 ml. 200 ml is missing. It is still inside. It doesn't mean that the Shuddhi is Ayoga. Because we achieved the Laingiki Shuddhi. We achieved the Kafacheda. Sometimes it happens. Only thesis it comes completely out. Or more quantity. 8 liter given, 8 liter 500 ml came out. Okay. So that is why the Chatushprakara Shuddhi is very important. In the here one of the student, another student, she has calculated the number of possibilities of this combination of Vegiki, Antiki and Laingiki Shuddhi, and class to consider it as Pravara, Madhyam and Avara. There are 84 or 81 combinations we can see, possibilities. For example, Pravara Laingiki Shuddhi, Madhyama Vegiki Shuddhi, Avara Manaki Shuddhi, Kafacheda. What you should consider? It is Pravara Shuddhi, Madhyama Shuddhi or Avara Shuddhi? Like that? Pravara Laingiki Shuddhi, Avara Vaigiki, Avara Maniki, Kafacheda. What we should consider? Like that, combinations we can make with this total 84 or 81. So we were on the way to make a tool for that, but it didn't happen. We'll take up later. So like that, we should understand the different possibilities of this. But now how it is, by seeing the patient, okay, fine, Kafacheda, ठीक है, Madhyama Shuddhi, Avara Shuddhi. ऐसे ही blindly we are telling. There is no structured tool is there. Okay. Next slide. Antiki Shuddhi. Antiki Shuddhi, you have seen the sulfur dusting model. So it is a simple tool developed during my postgraduate studies. So by considering the Pitta as bile, sulfur dusting test is a simple test to identify the urine पे करता है. क्यों? Bile salt test. Urine bile salt test is the sulfur dusting test. So the basic principle behind sulfur dusting is when the bile salt are present in the urine, its surface tension will be less, so that when we dust the sulfur, it will sink. If bile is not there, surface tension will be maintained, it will float. Similarly, when we collect the Vamana Dravya in between, sometimes the Kapha will be there, thick Kapha layer there. So Pitta doesn't matter for Kapha. It will obstruct the sulfur only. So first remove the Kapha layer from the collected liquid, and to the clear liquid dust the sulfur. If Pitta presence is there, of course it will sink. So in visible Pitta also it is seen, and without Pitta also, visible Pitta also we can see. The problem with the objectivity of Antiki Shuddhi is sometimes what happens, it mixes up with Yashti Fanta, and we may not be able to differentiate it properly. And again we have to depend on the patient. Abhi muh mein kya taste hai? The second time if it is Vamana, surely he will tell, हाँ abhi kadwa hai. Now it is tikta seta hai. It is some sour taste is there. If it is second time, he knows that. Last time with this, he stopped. Right? So here also I had some experience, Samyak Siddha Lakshana. They used to come to me with the application of oils. Still people are here. Okay, so that is why the objectivity, to bring more objectivity to Pittantata, the tool was developed. Okay, and see, there are 3 categories: Kafacheda, Pitta Darshana, and Pittantata. Pitta Darshana and Pittantata in the Charaka Samhita itself we can see in different contexts. In one context, Acharya says, Yavat Pittasya Darshanam. In another context, he says Pittanta, till Pittanta. And when it comes to the later Acharya, like Vagbhad Acharya, he adds one more thing, Chedova Shleshmano Bhavet. Maybe the capacity of Vaidya reduced or the patient capacity reduced, that I don't know. But still, some dilution he makes.
So what is the difference between Pittanta and...
I will explain. Good question. So, Pitta Darshana, Pittanta and Kapha-cheda, 3 things. Now coming to the Samyak Lakshana, Laingiki Shuddhi. Kramat Kapha Pittamatha Nilascha Yaseiti Samyak Mamitasya Ishta. So in that, Kramat Kapha Nirharana, Pitta Nirharana, then Vata. Okay, our main purpose of conducting Vamana is to remove Kapha from the body. So we can understand Kapha Nirharana happen properly by seeing the Kapha-cheda. By seeing Kapha-cheda we can see, Kapha Nirharana ho gaya. Are you sure? Oh wait, let the Pitta come. Then I make it sure. See? So by seeing Pitta, just seeing Pitta, we ensure that Kapha is completely removed, Pitta is coming. So we are doubt whether the Pitta coming is little earlier. So let us ensure, let it completely come. Pitta antata is. How we ensure Pitta is completely came out? By seeing Vata. So it is stage by stage progression of the perfection of the Shuddhi. Stage by stage progression to the perfection of the Shuddhi. Okay.
What are the indications that Vata is?
Vata, only the Vega will be there. He will be doing like that, no content coming out. Or else if you forcefully ask him to drink water or Yashti Fanta, the Vega will come with froth. No content. Only water will be coming out. What he drank will come out with the froth. That is indication of the Vata. Okay. So, Kapha-cheda, Pitta Darshana and Pittantata. Okay. So, when we try to achieve, this is the basic level. Kapha-cheda is sufficient. But you are little more curious, forwarded to Pitta Darshana, more curious, I want to achieve Pittantata. So when we try to achieve the maximum perfection, always there is a chance of risk associated. Always there is the chances of getting complication. Always there is a chance of getting Ati Yoga. That is why I usually tell this should be included in our interviews. When we select any clinicians to perform them Vamana, ask them to perform Vamana, and where we have to observe where he stops, in Kapha-cheda or Pitta Darshana or Pittantata. If he stops in the Pittantata, we can say that he is very much experienced. Sometimes by mistake also it happens, right? But we should assess his confidence. By this we can assess the confidence level of the Vaidya. Whether he is achieving Kapha-cheda, okay, initial. The person who started his career, just to started his practice. Whether he achieves Pitta Darshana, little more experienced. Pittantata, very well. Good confidence. Confidence in the sense, what this confidence means in context. Confidence in the sense, I am able to perform Vamana with up to Pittantata. That is not the confidence level. That is over enthusiasm. Confidence in the sense,
I will manage some.
Of course, that is the thing. If at all any complications happens, I am able to manage, or I can manage the complication. Because always when we proceed further up to Pittantata, of course there is a chance of complication. If at all any complications happens, I will not run out of the room, or I will not get the Sweda. I am capable to manage that complication. That should be the confidence level of the Vaidya. That should be the confidence level.
So is it possible without Pitta Darshana and Pittanta directly Vata means direct Kapha-cheda to?
Of course it happens, because today it happened like that. Because if Kapha Utklesha is very less, in such conditions, with 1 or 2 Vegas itself, the Kapha which is made Utkleshana with the Kapha Utkleshakara Ahara will come out, and only Vata Vega will happen. That also happens. Okay, so it is clear, I think. Next slide. So, samyak practice, the proper practice of the shodhana, proper execution of the snehapana, proper execution of the rukshana, proper execution of the kaphotkleshakara ahara, proper execution of the vamana karma, still sometimes it may end up in some complications, because purusham to purusha is different. One person to another person is different, and the situation in which he is sitting may be different. His mental status may be different. Okay, so that is why always we should expect for the unexpected, any sort of complication. We should be equipped with the materials required for managing the complications. Right? So, Hina Yoga, Ati Yoga, and Duschardita, non-cooperative patient. Non-cooperative patients I told in the morning how we can manage. If he is not ready to drink or adamant, we should scold him first. We should educate him first, scold him first, then make it written. Ask him to sign here under. For my death, I am responsible. He won't sign. He will tell, okay, we'll continue. Okay, like that, some techniques we need to adopt. Okay, because it is your responsible once the medicine is inside the patient till he go out. It is your responsibility. It becomes your responsibility. Okay, so non-cooperative. So duschardita. Duschardita is a beautiful condition, which is it may become a nightmare for you if it comes in your practice. What is duschardita? The person who never vomited in his lifetime. Such people also comes. I had a patient. So initially I was unaware of this duschardita. So I had a patient from nearby locality only during my initial practice. So he came for Vamana, and I educated him. Snehapana was very well performed. Without any hesitation, he used to drink ghee like water. Samyak Siddhata was achieved and posted for Vamana. Educated him how Vamana is. I forgot to ask him whether he vomited in his life any time. I was unaware of this point at that time. That is the true thing. So, posted. So, I educated him. Kal aisa karenge. Tomorrow, this much of liquid will be given. Medicine will be given. After that, 45 minutes. Within 45 minutes, you start to vomit like anything. Full tub. So, full picture was given to him. Next day, started. Abhyanga was done. And he came and sat on the room. And Akantapana was given, so easily he drank. And after that, Vamanaushadhi was given. No problem. Madanaphala Yoga, easily he drank that also. And I told, no, wait. Muhurtam anukanksheta. So started to wait. So around 30 minutes over, no problem. He comfortably sits there. He started, doctor, no, wait. Muhurtam anupale. We have to wait up to Muhurta. Wait 40 minutes. 45 minutes, nothing happened. So I told, then he started to look at me with a question mark. Whether this thing, what he mentioned is true or some wrong information. I told, we'll wait and see. 48 minutes, 50 minutes, nothing happened. Then I told you, just try putting your finger and try to vomit. Not vomiting. I given again kashayam. Again, Vamanopaka was given. That also he drank. Again, 5 glasses of Yashti Kashaya he drank. Nothing happened. So I told, okay, let us see. Hina Yoga management. Hina Yoga management, Siddhartha Gagana Datri. That combination. Again prepared and given to the patient. He drank that also, 1 glass full. Still it is not coming out. He comfortably sits there. So almost 1 hour over. So again I told, put a finger, nothing is coming out. He very cooperatively he doing all those things. Okay. He was very cooperative. And 1 hour over, slowly he told, sir, some discomfort, stomach, some breathing little difficult. Okay, let us see. Hot water bag. Again, hot water bag was given to enhance the Vamana Vega. So after that also no output. So Sweda Pradurbhava started for Vaidya. Not for the patient. I started to sweat. What to do further? Okay. So I told them, again we will see, wait. Again the this Yashti Kashaya was given, but nothing is coming out. Again his breathing difficulty increased, BP increased. He started to droop his head backwards. So this was slowly one by one increasing. And I thought that if we leave him like that, it will end up in some complication. So I told, forcibly you should vomit by putting finger or spoon, whatever it may be. He started with his finger, nothing coming out. Then Nala was given, nothing came out. Then I asked him to put the backside of the spoon, big spoon, and ask him to touch the throat and press it. So after that he vomited little by little. Maybe 25 ml one time. Only that much it came out. Again he put the spoon, again 25 ml. So almost 500 ml of the Aushadha came out. The vomitus came out, only 500 ml. But his discomfort level was reduced. Okay. Then I start to ask, whether you vomited in your lifetime anytime? No, sir, never. Why should I vomit? This is my first time. So, I know he was an alcoholic. Then I told, how much alcohol you drink? And he told, I am a businessman, I don't want to travel anywhere. By sitting in the home itself, I will manage all the business. Since morning, evening, I will drink. Since morning to evening, he used to drink. Okay, so Dushchardita, again 2 times it comes. The alcoholic patients, not Dushchardita, alcoholic patients, 2 times you will get. Different types. One is the persons who became Dushchardita by increasing their capacity, by drinking. They will never vomit. Another type of alcoholic patients are, they will easily vomit. By drinking 1 glass itself, they will start to vomit. These 2 kinds of alcoholic patients you will get. So you can understand the alcoholic patients by holding the glass, how they hold the glass, how they sip the milk. They won't leave that habit. By holding the glass and drinking, we can understand that whether he is an alcoholic or he is an alcoholic. Okay. So we can assess that. Now I can do that. Okay, initially I was not able to do that. So how much drinker he is, how much concentration he is giving to the drinking, all those things we can assess. This comes by practice. Just observe. Okay. So Dushchardita becomes such a nightmare. So after that, what happened is, after the discomfort is reduced, I sent him to the ward, and after 1 hour, Avipatti Churnam was given again, 20 gram of Avipatti Churna. Around 2 o'clock, he had loose motions, 4 or 5 times loose motion was happened, and no other complications. He was stable by evening. Okay, but the Vamana was a failure in that. And next again, Snehapana was given and Virechana was performed for his condition. Okay, so that is why we should always observe for the Dushchardita. In the history taking, we should properly take the history. Okay, and blood stains in the vomiters. That is one of the common complications nowadays we will get, blood stains. So you can see the blood stains in the vomiters. Because Jiva Shonita Nirgama is one of the serious complications. But generally it won't come in Vamana. It's not very common. The blood stains what we get in the vomiters may be because of many reasons. It may be by some capillary rupture, because sometimes the patients vomit with a lot of sound. If he vomits here, Vamana is conducted, all floor will hear his voice. Like that they will make noise and vomit. In that condition, there may be chances of capillary ruptures. And another thing, by Galapidana. by doing the nagha, injury caused by nagha, etc. There are also the possibilities of blood stains. Another condition very common nowadays is the amla pitta patients. The patients having gastric erosions. Because of Tikshna nature of the Vamana Aushadhi, there will be bleeding spots will be there in the stomach, and because of that blood stains will be seen. Okay, and what we need to do in this condition, whether we have to proceed for the Vamana further or we have to stop the Vamana. What we should do? Till up to what level?
Sir, we will check the vitals. If
Ah.
vitals are normal,
Ah.
then we can continue. If vitals are getting deteriorated, then we should stop.
Then what we have to do? Deteriorating vitals.
Sir, we should give some
Hmm.
and also Rakta Stambham Chikitsa we will do.
Okay. So, blood stains, as I mentioned, these are the simplest conditions. Sometimes what happens is blood stains will be, blood mixed vomitus will be seen. In cases of intestinal or esophageal varices, the rupture of the varices happens and lot of bleeding happens. At that time, we have to check for the vitals. Whenever we see blood stains, check for the vitals, monitor the vitals. Look for the pulse, volume. Okay. So all those things should be checked. If it is stable, we can continue the Vamana. And up to what level? We need not to go to up to Pitta Darshana. Instead, we can stop at the Kapha Cheda. Achieve the Kapha Cheda, your purpose is served, stop the Vamana. Okay. If the vitals are falling down, don't try to manage yourself. Better refer to the higher center for giving some anticoagulants to stop the bleeding. Okay. Otherwise, you will be in risk. And after the Kapha Cheda achieved, if blood stains are seen after Kapha Cheda is achieved, then what we should do? We can give some Ropana Gritas, if at all, after sending to the room. Some Ropana Gritas, small amount of Ropana Grita can be given, or some Pittahara Dravyas, like a Kamaduga, etc. can be, Priyangu Churna, etc. Mayura Picha Basma to stop the vomiting actually. Because here, vomiting stop karne ka zarurat nahi hai. Kapha Cheda chis, we stopped the vomiting. To stop the bleeding, to reduce the pitta only, we can give something. So, Priyangu Churna or Kamaduga Rasa or Grita, Tikta Grita, 1 teaspoon with hot water. Dissolve and ask to drink. It make a coating over the erosion areas. It will stop the bleeding. Then giddiness. Giddiness also morning we discussed. If the patient shows the giddiness, we should tap the cheeks forcibly. We should not allow the patient to sleep or close the eyes. Next. Next slide. So, Admanam Parikarticha, Sravahrid Gatriyorgraha, Jivadanam Savibramcha, Stambasopadravaklama, Ayoga, Datyogacha, the Sheda Vyapada Smrta. So, this ayogas caused because Presha Baishajya Vaidyanam Vaigunya Dadurasyacha. So, all the Chatushpadas are responsible, right, for the Vyapas. Vaidya only not responsible, but Vaidya is the main responsible person for the Vyapas. Next. Paschatkarma, Panipada Prakshalana, Dhumapana, Kavala, Samsarjana Karma. So, what is the importance of Samsarjana Karma after the Shodhana? Because all those Panipada Prakshalana, Dhumapana, Kavala is the basic understanding all of you have. What is the importance of Samsarjana Karma?
There is very much irritation in the whole intestine. So if we will go directly for a heavy food, it will cause a lot of complications like intestinal.
And how long we have to follow the Samsarjana Karma?
To which the inflammation is subsided.
How you understand the inflammation is subsided? And now you came to Agni Vriddhi. Beautiful. So, the Samsarjana Krama mainly intended for strengthening the Agni. Right? Agni, Yathanuragni, Trinagomayadyo, Sandukshemano. In that manner also we can understand, no problem at all. But how we will understand when to stop? Because Samsarjana Krama, according to the condition we can select. Whether we can go for Peyadi Samsarjana or Tarpanadi Samsarjana, and when to start the Rasa Samsarjana, and when to stop all those things. So that is why Acharya says we have to continue the Samsarjana and start the Prakriti Bhojana once the patient achieves the Prakriti Prapta Purusha Lakshanas. So if the patient achieves the Prakriti Prapta Purusha Lakshana, then we can say inflammation is reduced. What is that Lakshanas? Sarvakshamohi, Asamsargo, Ratiyuktaha, Sthirendriyaha, Balavan, Sattvasampanno, Vichneya, Prakritim Gada. Sarvarasa Abhyasa Kshama. He will be able to tolerate all the Shadrasas. Because starting from Snehapana up to the Samsarjana Krama, we are giving some bland diet, right? Only some mild spices will be given. Jeera will be given. No amla dravya, nothing. Only khichdi or peya is given. And suddenly after the shodhana, if you start to give some spicy food, of course it will cause some irritation and it will reduce the Agni. So that is why slowly we have to strengthen. And the beauty of that simile, Yathanuragni Trinagaumayadyo Sandukshemano Bhavati Kramena Mahan Stira Sarvapacha Mahan Stira Sarvapacha Tathaiva. That is the importance. So after the Shodhana, generally Agni becomes Manda, and when we strengthen the Agni with the help of the Samsarjana Krama, that Agni becomes Mahan Agni, a very strong Agni, and Stira Agni, that is very important. It will be very stable Agni. It will not fluctuate. One day you are feeling hunger, next day in very mild hunger. It's not like that. Once after the Shodhana, if strengthened with the Samsarjana Krama, that Agni will be Stira, Maha, and able to digest everything. Sarvapachastataiva. That is the beauty of Samsarjana Krama. Tarpanadi, Rasadi, whether modifications, whether we can do modifications in Samsarjana Krama. Peyadi Samsarjana, modification. Tarpanadi Samsarjana, modification. Whether we can modify.
Yes, sir. Sir, according to disease, we will have to modify. If Tabak Swas patient is there, and if we are giving Peya, rice, then
The Tarpanadi can be given.
yeah, and
Peyadi Samsarjana itself, whether we can modify. Peya Vilepi Makritam Kritam Yusham. It is mentioned, no. Whether we can modify that combination itself. That is my question. Disease condition, we have to select either Samsarjan Peyadi or either Tarpanadi, like that. Whether that structure itself, whether we can modify or not. That is my question.
sir, because patient is not able to take, so we can ask him to take that Peya only whenever he feels hungry, he can take that.
Chapati and dal.
No, sir.
No, sir.
No, sir. Means if in Samsarjan committee is mentioned that he should take in science, but not like that. We can ask him whenever he feels hungry, he could take a Peya. And he should take only that things, but should take multiple times whenever he feels hungry.
For vegetarian, we do not use monsters.
We can change instead of mamsaras some other modification. No, especially for North Indians, the problem.
Yes.
चपाती दे सकते हैं या नहीं? फुल का रोटी,
No, sir.
तेल नहीं है उसमें, हैं? दलिया, खिचड़ी,
Yes, sir.
दलिया with milk, without milk. So these things we need to think whether it is modifiable or not. We need not be very much orthodox also in some point. There are a lot of freedom given by the Acharya within the purview of science. So that is why we should understand what is the base of this Samsarjana Krama, how it is planned. So in the Sneha Vidhi itself it starts. What is the Ahara mentioned for Sneha Vidhi? Dravoshnam Anabhishanti Nati Snigdam Asankaram. This is the basic concept of the ahara, which should be sarvakarmasu ayam praya. Yanyahani pibettani tavantanyanya pityajed. Or this is the ahara which should be during the course of the snehapana, during the course of the shodhana, after the course of the shodhana also. The sutra is drava ushnam anabhishyandi asankara ahara. With this basic principle, whatever combination you want, you give, no problem. Drava ushna anabhishyandi asankara. So peyadi samsajana is planned according to this principle only. Tarpanadikrama is planned according to this principle only. So pulka roti nahi chalega. It is not drava. So drava ahara should be given. Right? So modifications are possible, but there should be some scientific in the sense शास्त्रोक्त. हमारा शास्त्र का अनुसार का some base should be there. Lot of modification you can do. You can use oats, you can use flakes, cornflakes. Okay.
So what is the first hour should be given after woman karma? Directly start Peya.
Peya you can give. So if you are doubtful whether the agni is properly hunger the patient achieved or not, then give mand, the liquid portion of the Peya. Only liquid you give, half glass. And after that again, if the patient feels hunger, you can go for the proper Peya. And
And there are some controversies. Some like they given the Peya given for 3 times for Pradhan Shuddhi. If a patient is hunger for 4 times or 5 times in a day, we should switch for next or
That's a good question. The modification of Annakala. Because Peya is mentioned 3 Annakala for Pravarashuddhi, Vilepi is 3 Annakala, Krita Yusha, 1 Annakala, 2 Annakala, Krita Yusha. And Akritamamsarasa 1 Annakala, Kritamamsarasa 2 Annakala. Like that we can practice. So 3 Annakala. So when we have to consider the Annakala, in a day 2 Annakala, for example, olden days it was 1 day 2 Annakala only. Morning 1 Annakala, Sayam another Annakala. Whether we can give the ahara accordingly. The patient won't come to you next time. He will die with hunger. Right? We have to understand the present Annakala of the patient. So now we are accustomed with the how many times you ate yesterday? 11 o'clock?
It's nice here.
Evening?
Nice.
But major Annakala 3 only. Okay, let us consider 3 Annakala. We are accustomed to 5 Annakala, but still we are considering major 3 Annakala. At least consider that 3 Annakala. So today Vamana is over. So the patient feels hunger around 2 o'clock. Consider it as first Annakala. And consider the dinner as second Annakala. Okay. And next day, again 3 Annakala you can calculate. Again, in between if the patient feels hunger, the ahara which is given on that first Annakala can be given to the between the second Annakala, repeated times. For example, 2 o'clock first Annakala ka Peya liya. Around 3 o'clock he feels hunger again. Give him Peya again. If it is hunger is there. Up to the second Annakala. Second Annakala say whether the ahara changes, that should be given next time. Got it? First Annakala Peya. And dinner also Peya. Next day morning also Peya. Okay. Let us consider tomorrow morning he has taken the Peya at 9 o'clock. Okay. And 10 o'clock again he is feeling hunger. Give Peya only. Lunch Vilepi starts. Second one. Right? Because 3 Annakala Peya over. 4th Annakala Vilepi starts. But in between Vilepi and Peya, you can continue the Peya itself if the patient feels hunger. Don't restrict him.
Quantity, how much quantity we should?
The quantity is not specific in Ayurveda anywhere. I told the numbers are not important.
We have to consider the civil cookshias in this.
We can consider. So we can ask the patient to accordingly.
If 1.2 liter is considered as modern, according to modern science, so we have to give up to 400 ml.
No, the thing is, I am against this quantification of the So 200 ml, 300 ml. So according to the hunger, we have to ask the patient how much hunger you have, eat accordingly. And full stomach, don't eat. That's all. Till full tripti, we should not give the ahara. Again, because the hunger, we are trying to strengthen the hunger. So suddenly if you give the maximum amount of indhana, Agni will reduce.
Sir, if patient asks on second day, if patient have 5 times hunger, can we switch on directly to Apurdush in night time?
No, it's not advisable, because the Kala Maryada at least we have to follow in this, because we are modifying the Kala Maryada to 3 Anna Kala. It is mentioned accordingly 2 Anna Kala, and 7 days or Dwadash Anna Kala is mentioned till the Prakrita Bhojana. And we are modifying it to 3 Anna Kala. Accordingly, the Prakrita Bhojana will come on the 5th day, dinner onwards. Okay. So in between, if the patient feels hunger, we can give the same. Next slide. Vamaka Kalpas. Okay. So all of you are familiar with Madanadi Yoga, Madanaphala, Yashti, Vacha, etc., etc. Very common, famous. Madanam Manabhayitvat, Sreshtatama Nyachakshati, all are familiar. But in Kalpasthana, how many yogas are mentioned? Why you are not trying all those yogas? There are many yogas. Madanaphala yoga itself, numbers we know, but we are not ready to practice. Okay, there are Madanaphala, Navayoga, Kashayeshu, Matra, Swashtu, Payodati. Like that, number of yogas are mentioned, different combinations of Madanaphala for different conditions. But we are using only one yoga. Madanaphala, Yashti, Vacha, Saindava, Hani. Fine, satisfied. Okay, so we used to practice different kinds of Madanaphala yogas, Madanaphala Sadhita Dadi, Madanaphala Shalatu yoga, Madanaphala Shalatu. Yes. How it was, Madanaphala Shalatu.
Madanaphala Shaladu is an unripe fruit of Madanaphala will be collected before it attains the yellowish color. Just when the greenish tinge is just getting over, it is called Shaladu. So that in that Pipili formation will not be in full. So it is considered that there will be less complications as of Pipili, and it will be dried in shade, and it will be used for that full fruit will be along with the bhajja will be used for as Vamaka yoga. And it was my thesis guided by my Ashwin sir, but he was proposing.
No, output.
My Vegas. Actually, the Vegas, I found it in our thesis also, and from the pilot study itself, the Vegas was very much better than the Pipili, and the Muhurta Kalanukamsha, when we are waiting also, more than Pipili, we found it the Vegas was coming very fast, and the time was also reduced, and it was found very effective. And in SDM, it is now widely practiced.
You are not practicing.
I am also practicing. Thank you.
Which form it is?
It is churna.
Same quantity you can use, right?
Same quantity.
No
Without
samskara.
any samskara.
Easy to use. That's right. Okay, so Madanaphala Shalatu is there, Sadhita Dadi, generally in Shwasa it is given, and Madanaphala Greya Yoga, that is the another one, Greya Yoga. In lotus plant we can sprinkle the Madanaphala and smell. But no much good Vega will not be seen with Greya Yoga. And in Bala and all we can practice that if the patient is not very much cooperative to drink the Aushadhi. Apart from that, there are a lot of other possibilities of Vamaka, like a Jimutaka is there, Pippali in case of Shwasa, Kanchanara Kashaya, or Nimbus Swarasa adaptation, etc., etc. And Madhuka Pushpa, in Maharashtra widely practiced. They use some roti or some out of Madhuka Pushpa, right? Maharashtrians who are there? कोई नहीं है महाराष्ट्र से? हाँ, मधुका पुष्प से नहीं बनाते हैं रोटी. Some seasonal food they prepare, madhuka. So it is sweet in taste, madhuka indica. So now I used to conduct Vamana with madhuka also. And Vatsaka yoga, Jimutaka, Kutaja phala, Vatsaka yoga. That also very essential. So Madanaphala Shodhana, as somebody asked in the morning hours, Madanaphala Samskarana we can say, Madanaphala Samskarana with Grita Madhu Dadi Palala. Each 7 days bhavana should be given, and Grita we have to keep the Pippali for 7 days, and again removing from the 7th day, again kept on the Dadi for 7 days, then honey for 7 days, and Tilakalka. Palala means Tilakalka for 7 days. Like that, each 7 days it should be given. And Grita, same Grita can be used for 7 days. Dadi also same Dadi can be used for 7 days. Honey also same honey can be used for 7 days. Tilakalka we used to change every day. New one. Okay. So the interesting feature which is observed during the bhavana with the honey is always we can see the initial viscosity of the honey will be reducing day by day, and at the end of the 7th day the honey will become like a watery. Okay, so that is also observed, and the thickness also will be reduced. Hardness of the Madanaphala will be reduced from the initial day to the end day. The color also slightly changes. So have you tried to break Madana Pippali, one single seed, with your teeth? It will not be possible if it is raw one. Very hard. But after this samskarana, you can just break it with little more effort. That is possible. So that hardness will be reduced. Okay. And we have conducted one study also in the Madanaphala, one in silico study. She conducted that. Her PG studies was there. In silico study of the Madanaphala, effect of Madanaphala, how Madanaphala acts in the body. So there are a lot of hypotheses related with the Madanaphala, that Madanaphala causes irritation, and you give a lot of milk and kashaya and all, distension of abdomen. So that is why, of course, there will be vomiting will be there, not because of Aushadha, etc., etc. And Madanaphala causes irritation, local irritation. That is why it causes vomiting, like that. There are a lot of such criticism also, hypothesis also there. So we thought we should have some evidence for the proof how the Aushadha acts in the body. So by thinking that, the study was planned, and I think she will explain. What was the outcome of the study?
So basically the study was divided in 2 sessions, like physicochemical analysis of the 3 samples which we collected from the Madanaphala, Shodhita Madanaphala, Pippali, then Madanaphala Majja, and Ashodhita Madana Pippali was also collected. So the study outcome from the physicochemical analysis was almost all the phytochemical components are more in more concentration it is present in the Ashodhita Madana Pippali than compared to Shodhita one. And there is concentrated physicochemical constituents were there in the Madanaphala Majja sample also. And the in silico study, it was a computational study with the chemical structures of these phytochemical constituents. So there it shows that morandianine, it is having like more affinity with the NK1 receptor, emetic receptor, than serotonin. Only 2 receptors, serotonin and NK1 was selected, like that.
So there are 2 receptors, one 5-HT3 and NK1. NK1 was selected, and both receptors showed affinity, and more in the NK1. Right, NK1, the affinity of these chemical constituents showed affinity to these receptors. The beauty of this thing is these receptors can be anywhere in the intestine, esophagus or up to stomach. So the chemical constituents which can trigger or stimulate these receptors and induce vomiting before it gets digested also. There are such papers also available. So that is what Acharya Charaka mentioned. Apakvam vamanam dadyat pachyamanam virechanam. The Aushadha which is in the apakva avastha causes the Vamana. Causes the Vamana. So before getting digestion itself, an Aushadha can act on the body. That is why we call it as Virya. Virya of the Aushadha acts on the body. Okay. And regarding the Shodhana, Samskarana and the Samskarita Madanaphala, it was my PhD study also. So there are two group it was performed, Samskarana and Samskarita Madanaphala. Because in Kerala there is a practice of using, conducting Vamana with Asamskarita Madanaphala. A raw drug will be collected and Pippali will be taken and it will be given as such after grinding with, mixing with Vachayasti, etc. Okay. So Asamskarita Madanaphala is a common practice here. And outside Kerala, it is more of Samskarita Madanaphala practice was there. So that is why we started to explore the clinical efficacy and the outcome, how Vamana is performed. So interestingly, we found that with Asamskarita Madanaphala, the Vega which is observed during the Madanaphala, Vamana was very projectile in nature, and in many cases we achieved the Pittanta or Pitta Darshana. But at the same time, the blood strains in the vomiters also was more in the Asamskarita Madanaphala. Okay. Apart from that, the increase of the blood pressure, Murcha, also associated more with the Asamskarita Madanaphala. But when it is done with the Samskarana of the Madanaphala, the Murcha was not found, blood strains are very minimally found, and Pitta Darshana was also found less. Projectile vomiting was also found less. But we could achieve the Kapha in that. Okay. So what I understood or conclude from this, that the Samskarana of the Madanaphala, even though Madanaphala is considered as Madanamanapayitvat, Sreshtatamanya Achakshate, because of Anapayi guna of the Madanaphala, it is becomes Sreshta. But with this Samskarana, the Madana becomes truly Anapayi or more Anapayi in nature. Even a beginner can practice the Vamana with this kind of Samskarita Madanaphala. Okay. Then Jimutaka Kshira Vatsaka Yoga. Leave it. Next slide. So Pittanta Vamana, sulfur dust, Kapha Cheda, I already mentioned in the morning. We have to observe for the thread formation from the mouth. Initially it will be very whitish in nature and touching the tub. But when the Vamana Vega progresses, it becomes transparent and thin and only water dripping will be seen. So by that we can understand the Kapha Cheda. Assessment with using fundoscopy, etc. We done some in 2-3 cases here itself with the help of Dr. Balaji, but we couldn't get any conclusions out of that. So again, now I am planning to restart that work of understanding Indriya Prasada with the Shodhana there at All India. And using measuring tumblers, digital weighing machine, litmus paper, etc., can be also, we should think something innovative always. What extra can be done? What extra evidence can be brought to the science? What extra objectivity can be brought to the, that is the role of the Panchakarma doctors. Because you also practice Panchakarma, Kajikasa people also practice Panchakarma, even Prasuti people also want to practice Panchakarma, Shalya people also want to practice Panchakarma. What is the Gada? Sabhi Panchakarma karna hai. So Panchakarma is not a speciality, moreover that it is a service department, it should be. That is what I understand. But as a Panchakarma postgraduates, teachers, academicians, you have a responsibility to create more evidence, to understand the mechanistic action of the Panchakarma procedures. So like that, we should plan and think about always, whenever we practice any sort of the Panchakarma procedures. Next slide. Mode of action, this is very common. Leave it. Next slide. Before that, I will narrate one story. So, iti kartavyata, because that is also very interesting. So, generally, the mistakes also makes us learn. So, some wrong practices what we done, or mistakes, or the complications what we have seen, also forces us to learn more about the things. Okay, so in the initial practice here in Amrita itself, and long back to 2007. So one patient came and I started practicing of my Shodhana procedures. So in the OP he used to come a Kitiba patient. So he was a driver from the nearby town. So OP basis management was performed, and during that time I encouraged him to get admitted for Shodhana because I want some guinea pig to practice Shodhana, right? So after PG, with a lot of enthusiasm joined and planning to start Panchakarma, etc. So every time I encourage him and teach him about the importance of Shodhana and all. So he had good confidence in me, some reduction with the Shamana Aushadhi itself. So one fine morning he came, sir, today I am getting admitted as told by you. Okay, fine. So I started Rukshana, and Snehapana was started. So I used to discuss with my colleagues at that time. So my wife is also a Panchakarma practitioner. She was also there. So I asked her, Kitiba, Vata Kapha Kushta is there. So shall I go for Vamana? He was a very thin, small person. Very thin, lean person. So she told, no, not suitable for Vamana. Because I had the same doubt, that's why I asked. He's not suitable for Vamana. But still, for confirmation, I asked her. But I was not satisfied. I asked another colleague, Dr. Krishna Kumar. He was also here. So he told, no, don't do that. Okay. So, okay, fine. 2 opinions sufficient. Vaidya Samuho, Samshekaranam. Right? Lot of confusions will arise later. So I stopped asking, then started Snehapanam, and Virechanam was performed. Vamanam was not given because the patient is not suitable. So after Virechanam also there is no reduction in the itching was there, scaling. Every day he used to get one handful of this much scales from his bed. Okay. So very obedient patient. Whatever I instruct, he will follow. Okay. Diet is very strictly followed. Everything is fine. So Virechanam was performed. Samsarjana was performed. Itching is slightly reduced, but not much. Scaling also, I can see that scaling is reduced, but patient satisfaction is not there. Scaling is reduced. So again, I told next time we will do one more Shodhana. Now you can get discharged. I will give some. He told, no, I won't go. After reducing this only, I will go out of the hospital. Okay. He literally stayed 90 days in the hospital. Okay. And after that, again, I given some gap. Again, Rukshana Kashayadara was performed. Again, I told Shodhana, Pakshe Vamanam Masi Virechanam Shanmaso Moksho Raktasya Masyam Tridanandaram. Okay, repeated Shodhana is very essential. So, Bala is less Bala. So, Stoka, Bahun Varan, Dosha Nirharana. That is the principle of Charaka for Kushta Chikitsa. So, again, Snehapana was performed, and again, Samyak Sigdhata was achieved. I asked others to Vamana. No, Vamana. Okay, Virechana. Performed Virechana. Second Virechana was over. And after that, during the Samsarjana Krama, in the same floor, second floor, I used to take class. At that time, house surgeons were not there here. So I used to take class. Suddenly, the nurse came to the class and said, "Sir, the patient is running in the ward." So in the same ward, there is 4 or 5 beds are there. In between, middle one bed is there. He was used to lie on that bed. He is literally running around the bed with wearing a turkey, but bath towel. When I came, the other patients are standing and looking at him. His wife is standing near to the bed and crying. This was the situation when I ended. It is around 2 o'clock, afternoon session class. So he was running around the bed, literally running. So I asked, what happened? What is the problem? Why you are running? No, sir, I am not able to explain. Some gabrahat, something. Paravesham, like that he mentioned the word. Some discomfort. Burning, some sort of discomfort during since noon time it is started. I am not able to stand. So I told what to do. All the patients are looking, 2-3 nurses are along with me, and wife is crying. This is the situation. Then I told the nurse, all looks like increased pitta. So we should reduce the pitta. That should be the aim. So I told, get some Madhifala Rasayana. So 20 ml of Madhifala Rasayana. One nurse ran away and bought Madhifala Rasayana. By that time I again had a thought that why can't we apply some Thaila? So I told Pinda Thaila, bring Pinda Thaila. Another nurse went, brought Pinda Thaila. 200 ml bottle of Pinda Thaila was bought. Madhifala Rasayana. I asked him to stop, drink Madhifala Rasayana. He drank. Again he started to run. And by that time Pinda Thaila came. I asked his wife to show her hand and poured full hand of Pinda Thaila to her hand. Then next time I asked him to stop again. Then asked her to keep the Pinda Thaila over the head. Full, one handful of Pinda Thaila. She applied the Pinda Thaila over the head. Again he started to run. Second round, third round, he came and stand in front of me. Sir, now it is reduced. I am comfortable. Then I asked, what happened? No, I don't know what is happening. This has happened here only. Okay. And from this, what you understand? I will tell what I understood from this. This is not magical thing or some over extraordinary thing. It's not such thing. It's a simple logical thing. What happened? Why such problem occurred to the patient? What do you understand from this? There's some situations during the last few hours I mentioned. What happens? Why? You can, if you can recollect, collect that threads, connect that threads here. Virechana, by Virechana, again Pitta Vriddhi happened. How? Ruksham tejo jurakaram tejasa rukshitasya cha. Repeated shodhana again caused the rukshana in the body. Because of rukshana, again increase of pitta. Because of that pitta only, this situation was created. So, Pinda Thaila and Madhifala both helped to reduce the pitta at that instance. Okay. So, after this, again started Snehapana, Kashayadara, mild Rukshana was done. Snehapana was performed. I never asked anybody. I didn't discuss anything with anybody and posted him for Vamana. And Vamana was performed. On the day of Vamana, evening, his itching reduced. Next day morning, scaling reduced to one hand. The powdery scaling, which used to collect in full 2 hands, reduced to 1 hand. Iti kartavyata. Definite action of the Vamana is demonstrated there. So Vamana, because it is a Vata Kafaja condition, so Kapha need to be considered first, and after that only we can proceed for the Virechana. Without considering this, directly repeated Virechana was performed, and which caused more Rukshata in the body, which further increased the Pitta. Okay. So, while considering the indication and contraindication, to that I am coming. While considering the indication and contraindication, we have to think 2 things. One is the Yogya Roga, Yogya Rogi. Ayogya Roga, Ayogya Rogi. Sometimes the Vyadhi may be Yogya for the Shodhana, but the Rogi may not be Yogya. The disease may be indicated for the Shodhana, but the Rogi may not be indicated for Shodhana. Sometimes opposite also. But in this case, the rogi was not indicated for Shodhana, but the disease condition was indicated for Vamana. In such condition, if the particular Shodhana very much requires in the treatment of that particular patient, we can proceed for the Shodhana, for example, Vamana in this patient, with a lot more precautions. Murdu Vamana can be performed with milder medicines. Murdu Snehana can be achieved, but Shodhana can be performed, should be performed. Then only we will get the proper result. Okay. So, and after the end of 90 days, when he went out, he went with a normal skin. With normal skin, literally normal skin. Okay. So that was the beauty. Okay. So with these words, I think it is 1 o'clock. 1:30. 1:15. Okay. So we'll stop the today's discussion. This is one of the beautiful quotes from Acharya Vagbhata. Namatra matramapyatra kinchid agama varjitam. So whatever I presented in front of you is from the text, from my teachers, from my father, and from patients. Learn from the patients with the recurrent practices. Okay. So wish you hitayu and sukhayu for and best wishes for your future endeavors. Thank you. Thank you. So there are different possibilities why Vamana Vega is not stopping. One of the main common mistake what we do is irrational usage of the vacha in the Vamana Aushadhi. Okay, irrational usage of vacha in the Vamana Aushadhi. Vacha, because the vacha is one of the centrally acting drug. Vacha is one of the centrally acting drug, unlike the Madanaphala and all. Okay.
Is it essential to use vacha? Because we have...
Yes, vacha is not essential also, but when we add the vacha, the tikshnata of the Vamana Vega or initiation of Vamana Vega happens much easier. That is why vacha can be added. Or that is why I used to advise only 4 gram or 5 gram, maximum 5 gram, not more than that. Vacha should be added in any of the Vamaka yogas. Because I had tried this during my postgraduate studies in Hassan itself. So I gave 8 gram of vacha and Yashti around 6 gram and Madanaphala 12 grams. This combination was given. Okay. So morning we used to start Vamana there at 5 o'clock and around 8 o'clock Vamana will be finished. So 8 o'clock Vamana finished and I sent the patient to ward. There is a semi-special room is there. He was staying it there. In the semi-special room, there is a bathtub is also attached. So I sent him to the room, and I went for my routine work, taking bath, and I used to come afterwards, taking breakfast and come back. So around 9:30, I came back. The sister was telling, "Sir, the patient is vomiting there." I went to his room. When I entered the room itself, I got the smell of that pitta, loha gandhi. Okay, so when I entered and see he was not on the bed, he was in the bathroom, it was open, so I went there. So in the bathtub I can see the yellow stains here and there. Because no contents are there, it is completely emptied. Then only he sent back, Aushadha is completely removed. But because of the increased concentration of vacha, he is having that continuous reflex. See, vomiting, then yellow stains I can see. So I thought, what should do? So I discussed with my teachers. It's PG studies. It's always freedom to discuss with the teachers. So Gurdeep Singh sir was there, Professor Gurdeep Singh. He was there at that time. So I asked sir, this has happened. What should do? Vacha centrally acting, इसका concentration जब तक कम नहीं होगा, vomiting करते रहेगा, ऐसा बताया. So vacha is centrally acting. So till the concentration of vacha reduces in the brain, that will continue. Then I asked sir, मैं कुछ शीतल उपचार करूँ? Some शीतल उपचार, परिशीका, etc. करो, कुछ फायदा नहीं.
Sir,
That like that.
sectron या फिर
Yeah, that we can forcibly stop with the modern medicine. Antiemetic, of course, we can have that. But this is the thing. Otherwise, once the content is emptied, there will not be Ati Yoga generally. So, but still, I have given the Shitala Parisheka and all, and up to 11 o'clock or 12 o'clock, he continued the vomiting. Okay, after that it subsided. He was a very strong man, so there was no other complications in and saved.
Madanpal Samskara, Buddha-Dadi Madhupala, Madanpal Pipali for 7 days each. Is there any reference for between 7
No.
days?
No.
And
It is taken as the basic bhavana rule. Saptadina bhavana.
we have to change color daily.
Yes, because otherwise it will become rotten and gives bad smell.
What about Dadi?
Dadi, no problem. It becomes more amla only.
Just we have to dip.
So grita, the problem is once you pour the grita, and I think some photographs also I have. The grita next day it becomes hard, solidifies. So morning you can keep it in the sunlight for half an hour and just stir it, again keep it closed. Again next day continue the same process. On 7th day wash with lukewarm water, take out the pippali, then put it in the next thing.
Wash with lukewarm water.
Yeah, yeah.
Rasa samsajan karma, how to practice?
I never practiced that. So
People churna, combination with other should be used or not?
no, I will finish that and come to you. So till now I have not practiced rasa samsarjana, and I have heard that the combination of rasa, some Vaidyas were practicing combination of rasa slowly introducing to the diet, maybe with amla dravyas including lemon and all, or madhura rasa guda including in the diet, or katu rasa like maricha pippali, starting with the jeera and coming to the up to the maricha, etc.
Peya Videti, we have to add that.
Yes, we can add little by little. Ah.
People churna, should be used or not?
For Vamana. Yes, Pippali Churna is indicated in Shwasa. So, alone Pippali, Saindava, honey is sufficient for the conducting Sadhyavamana in Shwasa.
Other for people,
Madan Pippali is not required. Pippali Churna, Saindava, Madhu. That is sufficient. And in Shwasa, again, the Jimutaka Kshira also can be used.
sir, your book is available.
So actually one Shodhaniya Siddhi published by Chaukamba is available. It is on practical these Shodhana procedures.
Sodhni Siddhi.
Shodhaniya Siddhi. It was available in Amazon. I don't know whether it is available or not.
Sir, do you have any experience of Sadhyavamana in Navajara-like conditions?
Sadhyavamana, we had a thesis also here. We conducted Sadhyavamana in Amla Pitta patient. Urdhvaga Amla Pitta, Sadhyavamana is indicated. And in Navajara also, here only one of the brahmachari, you might have familiar now with the brahmacharis here. One of the brahmachari who came with fever one fine morning, some heaviness in the body, and loss of appetite, heaviness in the stomach. Only in the night he started this fever feeling. So he came morning around 8 o'clock in the morning itself. So around 9 o'clock around we performed the Sadhyavamana with the same Madanaphaladi Yoga, and Yusha was given to drink instead of milk. And we kept him here up to evening in the hospital itself. And by evening he became almost normal. Only some tiredness was there. Heaviness was reduced, fever also reduced by that. So that was one experience in Sadhyavamana in Navajara. But Amlapitta we used to conduct regularly. Shwasa also used to conduct during Vega Kala.
So, sir, you were
And one study, one of my senior was conducted a study in Tamaka Shwasa. Vega Kalina, not Vega Kalina. Vamana conducted in Kafa Kala and Vega Kala, like that. So in Tamakashwasa. And it is, his conclusion was Vamana conducted in Kafakala has given better result.
So Madan, Madhyashti font is also needed in Sadhyavan, or only once we have to get the...
For which?
In Sadhyavan.
For what? In which condition?
Like in Jara, you...
Jwara, the same combination, Madana Faladi combination, it is indicated in Jwara itself. Same combination can be given. Okay. And for Shwasa, Pippali, that can be used. And as Vamanopaka, you can use Madana Phala Yoga. That depends. Around 15 gram, up to 15 grams of Pippali Churna can be used. And that depends on the strength of the patient, tolerance, capacity, all those things. Because after the Pippali Churna consumption, after each Vega, the patient feel burning sensation when the Pippali comes out. And Sadhyavamana in Patola Arishtavarina, that is mentioned in the Amla Pitta.
So here, Anandaraman is done. Then Aushadha is in some colleges, that second, after 1 glass of milk, the Aushadha will be here. And then milk will be completely fill Anandaraman. And then medicine. That can be followed.
That also can be followed. That is some practical modification. Because generally after Akandapana, if you give the medicine, suddenly the patient may vomit. So that may be the reason they have giving after, in between the milk, they are giving the Vamana Aushadhi. But as per text, it is after the Akandapana, Vamana Aushadhi is indicated.
Sir, up to what extent it is rational to perform or to prescribe the Vamana in patient having hypertension, uncontrolled hypertension or ischemic heart disease?
Actually, for Vamana, that is not a big problem. Because even cardiac patients also will vomit. Maybe with some other reason. Not as Vamana, but it won't trouble them actually. So, to be safer side, in the present scenario, it will be better to avoid. But many times, we don't know the patient who posted for Vamana whether he is having cardiac disease or not, because we are not performing the ECG and all. Now I am performing in ECG because it's a government institute.
Whatever said, we are regularly performing ECG of all patients.
Otherwise, it's not required.
Prior to Vamana, no any mandatory investigation we should is
Not required at all. But to be safer side, we can perform all the routine things. Even electrolyte also we can check. Electrolyte, especially for Virechana, we should check.
Sometimes while giving Vamana, just keep doing Akandapana and patient gets vomited. Continuously he is getting vomited. No need to give medicine. Sometimes it happens.
Many times it happens. But that is not sufficient for our Vamana. We have to stop in between. So for example, patient has taken 5 glasses of milk and almost 1 glass he vomited. Again you give 1 more glass, again he vomited. In such condition, we should ensure at least 2 to 3 glasses of milk is there in the stomach. Then give the Vamaka Dravya. And need not to wait up to Muhurta because it won't come. So in between we have to initiate.
Vega and Upavega has to be noted. Upavega, number.
Upavega noting is not required. Not required. Vega numbers also not required. That's what I want to stress. The numbers are not important. Like you should observe for the Lakshanas. Lakshana, Antiki. So there are a lot of such narrations, stories are there. With each and every patient there will be one story. So I can speak on some different stories throughout the day also.